Anyway, but it's important that we get the second part of today's lesson recorded for me. Anyway, so good versus well. So how are you today? How are you today?
Doing well.
Emmanuel? Emmanuel? How are you
I'm
today?
well, thank you.
I'm well. Okay. How are you, Yordell?
I will go with good.
Okay. And Linda, how are you today?
I'm doing well.
Okay. All right. I didn't ask how you doing. I said, how are you? Guys, either one can be used to answer that question. How are you today? I'm good, thank you. Or I'm doing well. Now, people often forget that good. Y'all know there have been some how many different quirks did I tell y'all about medical language? Language itself has all this different quirks associated with it. And good can actually not only be used as a verb to describe the action of a noun, in other words, he is a good driver, but it can also be used as a predicate adjective to describe the state of the noun. The noun is in good order. So it's not only to describe an action, it also describes a state. And if you use well in the same context, then what you're literally saying is, I'm not sick. So when you say, how are you today? I'm well. What you're literally telling that person, I'm not sick. And that doesn't make sense conversationally. But the truth of the matter is, either one is acceptable. I'm good, thank you. I'm doing well, thank you. All right. So the differences between sit versus set. This one is easy too. People sit, things set. Set your books on the table and sit down in the chair. People sit, things set. People lie and things lay. Lay your clothes over there and lie down on the gurney. So if you're saying I'm going home to lay down, you're going home to lie down. So if it's a person doing it, people lie and things lay. There versus there. Doggone it. Versus there. This is a place. This is a possession. This is a contracture. If contractures confuse you, don't use them. Say they are. This is a place. Over there. Put your books over there. This is a possession. Those are their books. So this belongs to somebody. Then versus than. I'm laughing because somebody had to correct me on this one once. And it was an oversight for me. I knew the difference. It's just that it was a typo, just an oversight. If you look on the keyboard, A and E are real close to each other. All right. So then, this is a time reference. I'm going home and then I'm going to have dinner. You're putting time order. And this one is a comparison. Mr. Mahone is a better teacher than Mr. B. You're comparing two things. This car is faster than that one. This is a place or a time order. Then We're going to finish this up and then we're going to get into career development. It gives you a time order. And actually, I've seen this one actually used wrong, both of them in the same sentence. Your versus your. Remember, if contractures confuse you, don't use them. You are. But the sentence was, if you're pregnant, you will need a note from your doctor. Both of them wrong in the same sentence. And that was written on the whiteboard at a school by a teacher. If you're pregnant, you'll need a note from your doctor. And I just stood there. It was written big, and I'm just standing there looking at it. They managed to get both of them wrong in the same sentence. Anyway, so if you need grammar classes, did you know you could just go to your local college and just sign up for a class without it being part of a degree program? Of course, they're going to try to sell you a degree program while you're there. But if you just want to go to school and pay $350 to take the English class, you can do that. If you're working for a company and let's say they promote you to office manager, you might ask them, would y'all be willing to pay for an English class where I can go over and bump up my English skills, because I'm going to be doing a lot of writing for the company right now or in the future. Okay, so anyway, that is grammar. A lot of grammar pitfalls out there, guys. And the best way for you right now is to have people double check your work. And that was always a biggie for me. Hey, Doc, will you take a look at this and let me know what you think? I mean, these people have degrees. Remember that when doctors go to school, it's not just medicine. They also take English, sociology, math, all the prerequisite classes as well. So, hey, Doc, take a look at this. Tell me what you think when you get a minute. And that's when he called, hey, Mo, yeah, listen, you're confusing then and then. Oh, okay. So, and then if nothing else, your office manager. I finally had a rule that nobody sent anything out of the office without me proofreading it first. Because I had airmen who were writing supply requests, writing down to supply, trying to justify why we need these new type of oxygen tanks, things like that. And these folks were bringing this stuff back to me. One guy, he come in the office, he said, he was from supply. He was NCOIC supply section. And he came in my office, he said, Mahone, what does this guy want? And he handed me the request because somebody had written him to ask for something from somebody who worked for me. And he brought it to me and said, what is he asking for? And I looked at it. I had no idea. I don't know what he's asking you for. It was just the grammar and the spelling and the formatting was just so horrible. You couldn't really understand what the guy was asking for. So after that, things like that happening to me a few times, I finally just, you know what, guys, don't send anything out of here without it coming through my office first. Because your grammar, your formatting skills, your typing skills, your spelling just sucks. And somebody needs to double check this work before it gets sent out. So no, I don't have an English degree. But practically through my years of working out there, I have an equivalent to an English degree. Again, learning from people who do have English degrees, teaching me as I'm correcting my work and so on. So anyway, you should know that some language is totally unacceptable in the workplace. Obscenities, sexually explicit, or risque comments are good examples of that. Risque, oh, you know, you look pretty good in that dress today. Be risque. It's not sexually explicit because I'm not talking about, you know, ooh, oh yeah, look at the shape of your butt, da da da. but just kind of, you look really nice in that dress today. Is kind of a risque type of comment. Or, lady walks by and guy goes, must be jelly because jam don't shake like that. Okay, that's a risque comment. And today is risky too. You might get your ass kicked. But anyway, now we already talked about terms that demean members of any racial, cultural, or ethnic group. We do need to go back just a little bit, and we'll make it all work out today. That we need to talk just a minute about sexual discrimination. Okay. Um, Guys, you have to know what qualifies as sexual discrimination out there in the world, because as people are educating themselves, you're starting to see more and more of these type of complaints and charges coming up against people. Okay. For example, how or not, for example, but healthcare is 98% female. Or excuse me, let me rewrite that. I don't know where I came up with that from. 86% female. Now, most of the doctors are still male. And they're catching up, females are catching up, but about 86% female. Right? And in our case, the sexual harassment is often directed at males. You see, what's happened is people think that when you put a male in a position of power, they tend to abuse that power with the females that serve under them. And that's not true. The truth is, when you put a person in a position of power, they tend to abuse that power. In healthcare, there are an awful lot of powerful females. The charge nurse of the hospital, the charge nurse of the ward, the director of patient services, and they have power, and they have people that work for them. And oftentimes, the sexual harassment is directed at men. I've been sexually harassed at work. Yep. And each time, not just once, each time, it's kind of icky to have some old broad, coming on to you when you're 21, 22 years old. And this 40-ish dishy chick is coming on to you, knowing, you're da-da-da-da-da. That's just kind of icky, y'all. It's just weird. And I don't care. I am not the one to jump on board and go, well, I'm a dog-ass man, so I'm supposed to hit that. No, I ain't supposed to. You're supposed to get out of my damn face with that bullshit. I'm bending over one day emptying a urine bag on the side of the bed. This is on the ward. I'm filling that up. And I hear from behind me, the little cat whistle. Really? Now, why am I so offended? Not because, da-da-da-da-da. I'm offended because if I did that shit, they would put my ass under the jail. If that was a female nurse bending over, emptying that bottle, and I walked by and Emery Mahone, can I speak to you for a moment? They would have lit my ass up. So it's the double standard that offends me in healthcare. Just like it offends y'all when you say things like women make less than men. That offends you traditionally. But this offends me too. That if I did that, they'd put my ass under the jail. Okay, so I'm assisting Dr. Cohen. I hate Dr. Cohen. I always have. Now, of course, Dr. Cohen doesn't know that because we've talked about that. We've had that conversation. Or I've had that conversation with y'all as to why. But anyway, I don't like Dr. Cohen. And at this place, we had a treatment room in the emergency services. And if the doctor needed to do a minor surgery, they bring them down to the emergency room and we would assist them in doing that. So I was helping Dr. Cohen do a cyst drainage. The cyst was on the back of the guy's thigh, high up on the thigh. So we had to have the guy undress from the waist down and lay face down on the gurney while we drained the cyst. We've got the curtain pulled and we're in there doing the procedure. Well, a few minutes into the procedure, the curtain gets pulled open. A young lady that works there in emergency services pokes her head in and looks. And I was like, what can do? And she just put her hand up, closed the curtain, and walked away. And I'm like, I hope she didn't just do what I think she did. Did she just poke her head in here to look at this man's ass? I hope she didn't just do that. A few minutes later, another young lady who didn't work for me, she worked in the record section, come up, pulls the curtain open, looks inside. And I said, what? And I'm just thinking, what? And she closed the curtain. Okay, now I'm pretty upset right now. I can't wait to get out of here and find out what's going on with these two wingnuts. But when we finished the procedure, Dr. Cohen, we just put the last piece of packing in, we put the dressing on, and Dr. Cohen says, okay, sweetie, you can get up. And smack that man on his ass. They're not often that I'm speechless, y'all, but I was. Did you? Okay, flip the script. You're having your pap smear. And when your doctor finishes your pap smear, your doctor says, okay, sweetie, you can get up. How weird would that shit be? And can you imagine your response to this creepy weirdo dude? Did you just smack me on my ass? I couldn't wait to get out that damn room. I mean, it sounded like World War III coming from my office because we had typewriters. I was wearing that shit out. Keys were getting stuck on each other. I know damn well they didn't just. The girl that worked for me, I gave her a letter of reprimand and sent her to sensitivity training. The girl that worked in the record section, I let her manager handle that. He and I weren't very, relationship between us, so I just let him handle that. And the doctor got a slap on the wrist. Yeah, that was not, you shouldn't do that. Probably liked it. Now, remember what I said about character? It'll all come out in the wash. Dr. Cohen stole some drugs from work. And guess who she tried to steal them from? Me. All right. She came in one night, said she needed some drugs out the drug cabinet. I opened the cabinet. I said, go ahead, take what you need. She took it, started walking out. I said, hey, where you going? Well, I'm going, no, you need to write a prescription for those. Those are controlled meds. You need to write a prescription. Well, I don't have time for that, Sergeant. You will write that prescription. Well, you just do what you have to do. And she stormed out with the drugs in her hand. So I called her doctor at home, or her boss at home. It was like 11 o'clock at night. I called her boss at home. Now, see, if I like you, I would have followed you down the damn hallway. Doc, what you doing? You know you can't do that. What's going on? But if I don't like your ass, shit, go and walk out with him then, shit. And call your boss right at home. And yes, she lost her medical license for stealing drugs. So again, they need us to support them. We need them to employ us. It's that situation. So anyway, that's symbiotic relationship. So anyway, sexual harassment. Does that mean you can't ask somebody out that works with you? Let's say your company doesn't have a employee dating policy thing, and you just want to ask this person out. Can you do that?
Yes. And if they act funny about it, make sure you apologize and leave it alone as quickly as
You
possible.
can do it, but it's not recommended.
Okay. Anybody
You
else?
can do it. You just have to be very careful on how you pursue it because some people have different values and morals, and sometimes that's not appropriate. Like for me personally, I don't think it's appropriate for someone I work with to come and ask me out on a date. And the reason I feel that is because I've gotten years of management experience, and I would not allow coworkers to date because of what could come up in the future. But that's just my personal preference.
So if I say
I wouldn't
something,
do it.
yeah. So if I say something like, "Hey, you know what? When we worked on that project together, I kind of saw, a clicking between us. Would you like to have dinner with me one evening?"
That sounds appropriate to me. You didn't go too far and you wasn't like aggressive, like, girl, I wanted to smack your ass and all that type of stuff. So you
Right.
came
Exactly.
appropriately.
I agree with that. That was very appropriate and respectful.
Okay. So if you say, no, thank you. I don't go out with people that I work with. There you go. Now, if I come back tomorrow and say, did you give it any more thought? Are you sure? Sexual harassment.
That would be inappropriate. That would be, it's just with any other thing. Hey, I don't smoke cigarettes.
That's sexual
I told you no, don't ask me again. Now you're just being disrespectful.
If I go to another coworker and I say, man, yeah, I asked that bitch out, but you know how they are. Mm-hmm. Just being ice bitch, probably a lesbian. Mm-hmm. That's sexual harassment. Yeah. And that's whatever that basketball player's name was. I don't remember his name, but he was a good player, retired, and he went to work for the team and scouting out new talent. And he asked some lady at work out, and she said no, and he called her ice bitch or something like that. And somebody overheard that. And now he's on national TV saying that he only said that, this is a black man, that he only said that because that's what we call our women. That's exactly what he said. My wife looked at me.
Isn't that defamation of character as well?
Yeah, my wife looked at me. I was like,
Sure you can't hear me.
looking at me for? I didn't say that shit. He said that silly shit, man. But guys, and that goes to prove something that has always been true in the media, is that it's better to look stupid than guilty.
But Mr. Mahone, isn't that defamation of character as well?
It is, yeah.
I was like, isn't it both for the write-up?
But it's better to look stupid than guilty. What I mean by that, the world can forgive stupid. And no matter how stupid what you say is, there's somebody out there that might go, yeah, I can see that. But if you admit to guilt, we can't forgive guilty. So it's better to look stupid than guilty. It's better to say that I didn't know that sex included oral sex. And there's somebody in the world that might, I can see that. But if you admit to getting a blowjob in the White House in the Oval Office, we're not going to forgive that shit. If you admit to lying to Congress, they're not going to forgive that. So it's better to look stupid than guilty. Come up with these stupid explanations. Everybody knows it's stupid, but at least you didn't admit guilt. The judge who said that they caught him, he pulled out his penis in front of the undercover cop in the park. So they've got him facing charges of indecent exposure. And his response is, well, I had to pee urgently. I have a large prostate and I had to pee and I couldn't hold it. So he goes in this big ass park, walks up to one person who's standing there and whips it out right in front of him. He couldn't turn his back or find a bush. No, just right in front of this dude is where I decided to be. So how dumb does it sound? Yeah, it's dumb, but at least I didn't admit guilt. So anyway, sexual harassment, guys have really got to understand that some of the things that we do and we call it reflex is not appropriate. For example, you're walking down the hallway, a lady walk past you, you turn around and you check out her butt. It's not appropriate. And some guys will tell you it's just reflex. But in the workplace, you better control those reflexes. Doing the body check when you meet a person. I mean, when you meet a lady, y'all remember that? Or remember the first time it happened to you? Hey, how you doing? Yeah, that is not appropriate. And we have to check those reflexes. And men will tell you, oh, it's just a reflex. And you know what? Do I? Yeah. Out there at the flea market, I go, yeah. But I have never turned around and chased some woman down and go, hey, you got a nice butt. What's your name? I just look. It's not, boom. Do I do it at work? Not even close. So, yeah, I guess I'm a dog in that sense. But at work, I am not about, because I know what constitutes sexual harassment. And you should know too. So anyway, you're going to have another class on sexual harassment when you get into PCT and your medical assistant classes, and they'll go a little bit deeper. That's why I don't include it a whole lot in this, but I did want to talk about it. All right, so.
Sorry, sir. Okay,
What?
I know we're going to the, I'm going to the piece, the thing next, or when, by the 8th. Is that an in-house? Or are we going to be still on virtual?
It's going to be hybrid. It's going to be a little bit of both.
Okay.
You'll do your lectures virtual, and then you'll come into class a certain number of designated days to have your hands-on.
So is it going to minimize, like some of us are MAs, are going for MA, and the other ones are going for the PC? Are we finna split that up even more then?
Possibly. In other words, Monday will be lab day for Bedalia, Renisha, Jasmine, and Jordan. And Tuesday will be lab day for Jaime, Jennifer, Angel, and Didi. That might be the case. We try to get them all in at one class in at a time and separated by 2 separate teachers. So we'll have you all come in, and then you'll go to 2 different lab rooms, and you'll be assigned a lab teacher. We got to keep the class size down to no more than 10 in a room at a time. So it might be an instance where your teacher needs you to come in, you 5 come in the lab and work with me, you 5 sit in the room and work on your homework. And then in an hour, we'll rotate. So we're trying to get everybody the right amount of lab time without, and still maintain, safety. So they're being really creative with how they're getting it done, but they are getting the labs done. And by the way, did everybody that got that email go over and get your scrubs or planning to? Did y'all get the email from me?
I didn't get an email.
Okay. If you're a new
This
student.
is Vidalia. I didn't get none either.
Right. If you're a new student, you didn't get it. It was for the 7/27 start. Y'all scrubs are here. Your Belle and Jordan and Jaime and Crystal and Selena, Vanessa, Davion. Those people started on 8/17, or excuse me, 7/27. Their scrubs are here. Remember, the 8/17 start, your scrubs won't be here till the 3rd week. So new students, you didn't get the email. I only sent it to the 7/27 starts. So get over there and pick up your scrubs when you get a chance. There's no rush. You're just going to need them by the time we finish, and that following Tuesday when we start class back.
Okay,
All right.
one more question before I stop bugging you.
I know. Jeez.
Did you send out the prefix, or yeah, I'm saying it right, prefix study guide? Because I got the link for the test, but I didn't get no prefix study guide one.
The study guide is the list that we went through. Remember all those word part lists? The root
Also
words?
the same one. Okay.
It's the same one. It's just go down 2 pages and it starts prefix, suffix. And then a couple pages of that and it starts abbreviations, acronyms.
And it's due today or tomorrow?
Tomorrow. But I want to get it done tonight.
It's due tomorrow by 2 p.m.
By 2
And
o'clock.
that list is attached to one of our class recordings.
All right, so where is, there's Talisha. Butler had an appointment. Jordan is here, Yardell is here, Renisha is here, Jennifer's here, Davion, Jaime, Jasmine, Linda, Melissa, Vanessa Pargas is here, Vidalia's here, Selena is here, Angel is here, right? Where's Angel? Angel. Thought I saw Angel Myra Riojas. Angel Myra. Okay, not yet. Alma. I thought I saw Alma. Espinosa. Alma. No, not yet. Okay. Crystal is here. Savannah is here. Dee Dee is here. And Angel is here. All right. We get this part done. Matter of fact, y'all go ahead and, well, I like y'all to see me type this just because. Sending that to D. Today is 8/27. And today we are missing Butler. Medical appointment, and then we're missing Rico Haas. We're missing Segovia. Wait a minute. No, no. All right, so Angel, Angel Myra or Alma, anywhere. Okay. All right. Oh, okay. I can do that. Okay. So, no, wrong thing. Also sent out a sample resume this morning that you can use to type on as a template and create a resume for yourself. We'll go through all the requirements or rules for putting that kind of stuff in there as we talk about career planning today. So that's the third section of professional development. The good news is that we'll finish this today, and then tomorrow we'll be back in the textbook. And for my new students, you'll be in the textbook from then on. So starting tomorrow, everything will come, all the lessons will be all through the textbook from now on. All right, professional development. We're talking about career planning. Putting some thought into how your career progresses. Now, you can just kind of, you know, sit back and follow the road as it takes you. Or you can plan these off ramps in your career. When I get to this point, I'm getting off this road, getting onto that road, and taking my career in a different direction. Okay. And career planning is going to kind of help you keep your career in the direction you want it to go. And what you need to be considering now, first of all, what do y'all think is the difference between a job and a career?
Security.
Security. Okay.
A job you have to put up with. A career is your choice to do. You know.
Okay. A job is something you have to do. A career is something you want to do. A career says something about you. Jobs usually don't. For example, if you work in Walmart, and not to say Walmart can be a career for a lot of people, okay? But if you work in Walmart and it's just a job for you, then you're just going through the motions. It doesn't tell us anything about you as a person, but careers usually do. We choose careers as opposed to find jobs. What type of environment would you think you might like to work in? Has anybody given any thought to what type of clinic or what type of ward you want to work on? I know some of y'all, my PCTs, can look forward to working in a hospital. And that's pretty much what the difference is between PCT and vocational nurse, or excuse me, PCT, vocational nurse, and medical assisting. Okay, is where we're training you to work. In the medical assisting class, when you go to lab, there are no beds in the lab because it's all about the clinical environment. People come in, see a doctor, go home. That's the clinical environment. It's outpatient. It's Texas Med Clinic, Kellum Clinic. Again, come in, have your appointment, go home that day. PCTs are training to work in inpatient environments. Come in, check into the hospital, have your surgeries, get cured of your cancer or whatever, and then you go home. And that's the difference, or the greatest difference between PCT and MA, where we're training you to work. PCTs are training to work in the hospital. When you go into the PCT lab, there are going to be hospital beds, trays, overbed tables, IV poles, the whole 9 yards, everything you expect to see on a hospital ward. When you go into the MA lab, there's going to be phlebotomy chairs and exam tables and lab equipment and centrifuge and the things that you would expect to do in outpatient environment. So that's the difference, where you're planning or where we're training you to work. Now, that does not mean that a PCT can't work outpatient. The focus of your training will be inpatient. And medical assistants, and I'm saying that you can't work in a hospital, but the focus of your classes will be outpatient services. Now, as far as moving around or growth, PCTs may have more options for moving to different environments, because in a hospital, you're going to have all these different environments. A PCT could be working on the OB ward, or the orthopedics ward, or the medicine ward, or oncology. Or you might find yourself working in emergency services. So it's a lot easier to move around to these different environments because it's all one company. And the way it usually works is you're working the ortho ward. One day you're headed down to lunch, check the bulletin board and see what openings there are in the building. And you might see on that board, looking for a PCT for the neurology clinic. Oh, and you might want to run down and apply for that. And you would apply for it just like any other job. It's just, it's all the same company. Medical assistants will tend to work in a specialty area and will be part of this company. But if you move to a different specialty, you actually be moving to another company. So the growth potential or the spreading around of your skills would be more, will work better in a PCT environment. Medical assistants, however, remember now you're talking about what would be the upside of what you're doing. Monday through Friday, 7:30 to 4:30, weekends, holidays off. PCTs, remember we need y'all 24/7. Swing shifts, night shifts, so the chance to pick up extra shifts as well. If you want to double up and do double shifts, PCTs are more likely to be able to do that. A medical assistant who wants to double up will typically have to work this clinic in the day and then go to another clinic in the afternoon or in the evening. Or get you someplace like Texas Med Clinic that has evening clinics. So if you're working at Kellum Clinic and Kellum Clinic doesn't have a Saturday clinic, you could work for Kellum during the week and do Saturday over at Texas Med Clinic. But you would have to be hired by both companies and receiving 2 separate paychecks and like a part-time job. So it's a little, both directions have their benefits, It just depends on what type of patients or clients you want to spend your day with. You want to do the inpatient stuff, or you want to do the outpatient stuff? So what type of environment would you want to work in? Do you want to work in pediatrics? Anybody? Peds? Peds? Oh, I want to work with the babies. Oh, look at y'all. Okay. But remember too, that pediatric cares for everybody up to 18 years old. So you're not just doing the babies. You're doing the 14, the 15-year-olds, the one who have an attitude about having to go to peds. You know, you're doing the 180-pound football player who's 17 years old, got to come to pediatrics, sit down on a little chair with the big bird, placed it on the wall. Yeah, you're dealing with that, those type of attitudes too. The 17-year-old, the 16-year-old who knows everything, can't tell them shit. Yeah, that's pediatrics too. So anybody want to work in OB-GYN? Anybody want to deliver the babies? Hey, yeah, I mean, okay. Oh, so remember I said when that doctor gets that call at 3 o'clock in the morning, first place they're going to call is the hospital, let them know we're on our way. Second call is going to be to you. Yeah, Linda, Miss So-and-so is getting ready to drop. Come on over and meet me at university. Okay. 3 o'clock in the morning. Your husband going, hey, where you going? I got to go deliver a baby. That's the third one this month. Well, yeah. How I know it's not a boyfriend you going to see. And yeah, you're going to do some of that too. I hope she worth it. That's my wife. I hope she worth it. Yeah, punk. Anyway, so anybody want to work like psych? Mental illness. Go work at the state hospital. Take them down. Yeah. Use force. Wrestle them down to the floor. Blah, 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 blah. Nobody wants to work in psych? Psych is fun, man.
This is Vidalia. I'd like to work in the psych ward or maybe hospice or somewhere along with elderly people.
If you work in psych, man, there's something new every day, y'all. Never a boring day. And your days just fly by like, boom. One patient acting a fool, you're dealing with that. Next thing you know, it's time to go home. Your days just fly by. Anybody
I got
else?
a question.
Yes.
Can patient care techs work? Darn, I forgot just that fast. I'm gonna come back to you when it come back to mine.
Okay.
I just
All right.
forgot.
I want to work in psych. I want to work with the people.
If you think you want to work at the
State hospital, yeah.
state hospital, yeah, PCTs and MAs both. Yeah.
I want to go over there. They pay
Remember
more for
those.
damage.
Remember at the state hospital, those are wards, and you'll be working in the ward just as if it was an orthopedic ward. Yes, Vidalia.
I have a question about the PCT. This is my first time like really jumping into the medical field and having any type of knowledge. So I'm very ignorant, but very eager to learn. But I have a question. With the PCT, are we going to be certified or actually be able to go into an office and be able to be trained to serve medication? Because ideally, I'd like to end up at the state hospital and I'd like to end up doing medication distribution and whatnot. But I'm not too sure if that's even covered with the PC.
Okay, as a PCT, no, you won't be administering medications. Okay, you're gonna have to bump up your game. In other words, continue your education and bump yourself up to RN, if that's where you want to go in your career. Okay, that's what RNs do. They administer medications. So when you're on the wards, that's pretty much what it's going to boil down to, guys. The PCTs and the vocational nurses will be doing all the bed care, dressing changes, feeding patients, helping patients get shaved and cleaned up in the morning, helping patients to ambulate, emptying urine bags and all that kind of stuff. And the nurses will be pretty much walking around administering all the medications, hanging the IVs, giving the patients their shots, giving them their pills to take and so on. Now, that's how the RN's day is pretty much filled. You're doing all of that, and then when you're not actually passing a med, you're up at the desk documenting. doing your documentation.
Mr. Mahone,
So most of the hands-on care is going to be done by the PCTs and the vocational nurses. Most of the medication passing and things like that is going to be done by the RNs. Yes, Melissa. Or who had a question?
I was gonna say, I want to work at a dialysis center, but I wanted to ask too, for PCTs, can they work like a full-time phlebotomist or no?
Yes, yes. Y'all can, because why? 3 certifications. When you're done with your courses, you'll be eligible for 3 separate certifications. And whose idea was that, by the way? You're welcome.
Thank you, sir. Good job.
We're the only school in town that does that. And they said, Mr. Mahone, how can we improve? How can we bump up our student numbers? How can we get more students attracted to the school? Dual certifications.
Sir,
You
I have a
you were
question.
very right in that, Mr. Mahone, because
Yeah.
that's the only reason I chose to go to this school.
Yes.
I have a question. I know
Yeah.
in California you have to have, as phlebotomists, we actually have to be licensed as well. Or do we not have to be licensed in Texas? It's just a certification?
Okay. That is a good question and something we need to talk about. What is the difference between licensure, certification, and registration? And let me describe it like this. You may have seen this symbol before. If you look at electronics like computers, TVs, dishwashers, washers, dryers, refrigerators, you might have seen this before. A little yellow sticker on there somewhere that has UL inside. Have you ever seen that before? If you look for it, you'll see it. If not, you probably, it stands for Underwriters Laboratory, UL, Underwriters Laboratory. What is that? It's a third-party group out there that has been established, I think, in the 70s or something like that. And what they say is, if you say that this washer will last 10,000 cycles, how do we know that shit's true? How do we know you're not just saying that? You send one to them, the Underwriters Laboratory, and guess what they'll do with it? They'll run it for 10,000 cycles. And if it lasts, they put their stamp on it, their stamp of approval. There's a third-party organization out there that tests this stuff and says, yes, it does exactly what the manufacturer says it will do. So it's a way for a consumer to look and see, okay, this does do everything the advertisement on the box says it will do. It's been underwritten. So what are these two right here? Stamp of approval. A third-party group out there. You're the first party. Quest College is the second party that say that you are a medical assistant. So how do we prove that? We get third-party stamp of approval. Somebody else, in a disinterested organization, to say, yes, they did learn everything a medical assistant should know. And that's what these are right here. So you go to school, you graduate, you sign up to take their test, they test you and say yes. They do exactly they know exactly what medical assistants should know when coming out of school. And they put their stamp of approval on you. They give you their certification, or they add you to their registration list. So they're both the same. Certification, registration is the same thing. It's just what this third party decided to call their certification. This third party decided to call theirs registration. But there's no
Does
difference.
it affect your pay at all?
Huh?
Will it affect the pay at all?
Absolutely. Now, I've seen some places out there advertising for non-registered medical assistants. And why do you think they're asking for that specifically? so they can pay a little less. Do you have to be registered or certified to be hired? No. Remember, I said a doctor out there or a hospital out there can hire anybody they want. But registration or certification says that I have completed and I have the knowledge that goes along with being a medical assistant or a PCT. So, which one do we use? Okay. In California, the largest credentialing body, and that's what this is called, a credential, and the credentialing body is that third party. The largest credentialing body in California is, or it has chosen, certified medical assistant. The largest credentialing body in Texas is registered medical assistant. They call themselves, by the way, AAMA, American Association of Medical Assistants. And what they issue is registration. In California, I don't know the name of the organization, but what they issue is certified. And the downside of that is that if you move from Texas and start looking for a job in California, all the advertisements are going to say this. And half those people out there won't know that this is the same thing, just a different state. So you'll have to switch to CMA when you move to California. Same thing, vice versa. I knew a lady who had a CMA, and when she came here to Texas with her husband to start teaching classes, she had difficulty because everybody was looking for RMA. And in human resources, they don't know the difference. Now, as an office manager, yes, I know. But when you send your application and it goes to the human resources department, they'll look at this and say, no, we're looking for an RMA. And she was having difficulty. So how do we avoid that? We don't use Texas. We don't use California. The certification that we issue, our third party credential is national. It's recognized in every state. Nationally registered, certified medical assistant. It means that you are certified to do this job and your name appears on a national register. So you can go to any state. And that's why we do that. And by the way, who's responsible for that? Hey, y'all are welcome. Because when we decided to do all three, we needed to decide then which credentialing body to use. And yeah, the people I was talking to was on top of this one right away. Well, at my last school, we used AAMA. Well, we used that. Well, what about AAMA? Well, what about National Registry? Oh. Then our students can go to any state and work without having to reapply. So nationally registered certified medical assistant, nationally registered certified PCT, nationally registered certified EKG technician, and nationally registered certified phlebotomy technician. You will be eligible for all three of these, or these two and that one up there. So between the classes, you'll get this one or that one, and everybody's eligible for these two. Now think about putting that shit on your resume. And you're in that job interview for a medical assistant over at Texas Med Clinic. And they say, so how are you at drawing blood? I'm a nationally registered phlebotomy technician. Oh. Why? Because I got assholes walking up in here now talking about, I don't like to draw blood. Get somebody else to do it because I ain't no good at it. And you walk in there and say, well, I'm a phlebotomy technician. What, punk? Give me the job. So anyway, that is certification registration. Now, what about licensure? Now, we are not required to be licensed. And that's why we're not. And that's the only reason we're not. So when a licensed vocational nurse says, well, I'm licensed, the reason is We're not required to be. What does licensure mean? Licensure says that I have applied to the state for a license to practice in that state. That's it. Do you test for a license? No. For registration and certification? Yes. Do they do a background check for a license? Yes. For register and certification? Yes. So you're doing the same thing, you're just not doing it with the state. Why not? Because we're not required to. So a licensure doesn't mean anything extra. And that's what people often forget or believe, that when I have a license, my license puts me functioning at a higher level than these two. It doesn't. As a matter of fact, you don't even test for a license. You just apply for it. They check your background. If your background's clean, they issue you the license.
They make you pay in California for phlebotomy license. It's just money. It's like $75, $80.
Yeah, you have to pay for
They
that.
got ITB on
And that's for them to check your background. It's the background fee. Okay. So yeah, it's going to check your background for all three, but you only test for these two. So when somebody tries to convince you that being licensed puts you at a higher functioning level than registration or certification, they're wrong. They don't even know what they're talking about. You get a license just like you get a license to carry a gun. You go in and you apply, and they check your background. If you pass, they give it to you. Same here. They check your
Only
background.
reason I was asking because they weren't allowed to hire you in California without a license. And if
Yeah.
you did hire you, had like less than 30 days or 90 days, I think was to get a license, or they have to terminate you. That's why I was asking more about it.
Yeah, yeah. A state can require a license for anybody they want. But here in Texas, we're not required to be licensed. So all it is a background check, y'all. You apply for it, they check your background. You don't have anything on there, they issue you the license. That's it. So that's all licensure is. And people misunderstand that all the time. That, oh man, I got a license, so I got a license to practice, and that makes me a higher credential. No, it doesn't.
I have
Oh,
a question about the
Yeah, with
license,
the-
Mr. Mahomes.
and the background check is usually just a state background check. Yes, Vidalia.
Like I'm currently employed as a CNA, and I'm not licensed or certified or anything of such sort. But if I was to go apply for that said license and acquire it, could I go and demand a pay raise?
No.
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 So what's so special about that license? The fact that I'm paying?
If you have a credential that's not required in the job that you're applying for or in the job that you're working, you can't expect to be paid more for it. We have teachers who walk in here, it's like, well, I have a master's degree in this. Well, we don't require that. So we're not going to pay you for something that we don't need. You know what I mean? If we're requiring it, then yeah, we need to bump up our salary a little bit. But to walk in and say that I am a licensed phlebotomist, we don't require a license. It doesn't mean that we're going to pay you more money. We're going to pay you the same as everybody else. We require registration and certification, and not every place is required that. But you'll be hard pressed to find a place that you want to work that doesn't require certification or registration in Texas. And when you go to California, when you look at their job advertisements, it says we want a CMA. You come to Texas, they say we want an RMA. Guess what? You have both. So you're more likely to make your way through the human resources part of it. What human resources do, guys, they publish the advertisement. They get in all the applicants. They look at the application and make sure it matches what they advertised for. If it does, they pass that on to the office manager. So that's what I call the human resources filter. They're not going to pass anything on to the office managers that doesn't have everything that their job announcement asks for. Those are the ones that get pushed off to the side. So if the job announcement is asking for a CMA and you send this in, the human resources people aren't going to know the difference. And they'll say, no, that's not what we asked for. You won't even make it through the human resources filter. And your application will never make it to the office manager's desk. Okay. When they look at this, yeah, everything's in there. They got an extra something, right? But yeah, they're CMA. Oh yeah, they're an RMA too. So that's why we chose the national credential over any particular state credential. We want you to be able to be employed in any state without having to retest and that kind of stuff. All right. So do you prefer a large or medium facility? You want to be at Texas Med Clinic where you're seeing 150 patients a day with 12 medical assistants and 10 doctors walking around in there? Or do you want to be down here on San Pedro with Dr. Bob, where you are the medical assistant, you're the office manager, you're the supply technician, you are the medication ordering person, you are the insurance verification, you're everything with you and just that one doctor. Do you want to work in the same town? How many of y'all are willing to commute for that perfect job? That job you always wanted is open in Austin. How many of you would be willing to move to Austin or drive back and forth for that perfect job? Yeah. Do you want to remain in one place, or would you like to travel around? Be like a temp or seasonal? Different people all the time, different areas, changing up, kind of like being in the military. You go here for a year, move there for a year, and just kind of see the world and see the states. Would you like to go to a place where there is absolutely nothing to do and spend a year there for $200,000? And in that year, you're not spending any money. All you're doing is working. You go home, you watch TV, all your people are back down there in Texas. You're just gone for a year. Come back a year later, and guess what? The Lincoln Navigator and the and the blah, blah, blah. Okay. So come back flexing in a year. So would you want to do that kind of stuff? Guys, there are people in the military who go to some of these off places like that, and man, the whole time they're there, they're paying for their car. They're making car payments. Car they ain't even seen before. And the car companies will do this with you. It's 2020. If you go there today, you start paying for your car. After a year, you've paid the car off completely. The car that you get will be a 2021. It'll be a current car. So you're not buying a year-old car. And people do that in the military all the time. They come back from overseas, their car is waiting for them at the dock with the bubble wrap still on the damn thing. Totally paid for. Because while they were overseas, it was all about working and paying something, buying something. You spend a year over there, come back, brand new. This dude bought and really pissed me off, y'all. He bought a Nissan Skyline GTR. This kid was 22 years old, came back from overseas driving a $110,000 car. Anybody ever play Forza or any of those driving games? The Nissan Skyline is always in there. That's the baddest car ever built. Skyline GTR, $110,000. I saw one over at the IPAC Nissan over on 410 one day, y'all. And I was just like, it was sitting in the showroom. I was like, that's the baddest car ever built. 22 years old, paid for it, came on back home. So you see oil field workers do that kind of stuff. Go off to the oil field for a 6-month stint, come back with $75,000. So would you like to do something like that? Go up to Alaska for a year. Be medical support for the oil workers up there. And there is nothing to do, y'all. and then come back home a year later. Boom. Hey, how y'all doing? Yeah. Pay cash for a house. Shit like that. And some people will do like 4 or 5 years. They're 21, 22, 23 years old, do 3 or 4 years, come back with $500,000. And now ready to start their family in class. Is it important to work at a place with the latest technology? Would you want to work at the place that has the hemocytometer? It counts the cells for you. Or with Dr. Bob over here with a microscope, doing your own cell counts. Is continuing education important for you? Guys, there are some jobs that just don't lend themselves to continuing education. You're probably not going to go to school if you work in emergency services. Sorry. The hours and the shifts are just too unstable. And you'll be missing classes left and right. And that's how I was. I did try in the Air Force for a short period of time. I got into the community college of the Air Force, decided I was going to take these classes. And I couldn't finish the class. One class I was halfway through, shift got changed. Next class I was a quarter way through, got orders to another base, shift change. So there's some jobs that just don't lend themselves to secondary education. Technically, between the PCTs and the MAs, you're more likely to get a good, stable, steady schedule as an MA. And that's one of the trade-offs again. Yeah, PCT can move around a little bit better through the different disciplines. They have more options of schedules, but the medical assistant will have a more steady schedule and will be able to take classes in the evening without having to miss a class because they have to cover a shift somewhere. So is continuing education important? What shift or schedule would best accommodate you? Would you like to go to work on Saturday morning, get off Sunday night, or excuse me, get off Monday morning and be off for the rest of the week? That's a common schedule for some x-ray technicians. They go in on Saturday morning, they cover the entire weekend. By the time the weekend is over, that's 48 hours. You don't go home during that time. No, you stay there the entire time. And that's 48 hours right there. You just did your week's worth of hours and you're off for the rest of the week.
I have a question about that type of schedule, Mr. Mohammed.
Yes. Yeah.
When you're set to a schedule like that for the entire weekend, and for example, you're at the hospital and you're there the whole weekend, how do they usually break those hours up? Because I know in the medical field, sometimes you don't have lunch, you don't have breaks, and that's okay, that's understandable. But when you're doing a 48-hour shift, like, do they give you 16 hours on, 4 hours to go take a nap in the bunk upstairs, or how does that work?
What you do is that these are professions where there isn't constant work. Now, you would never get this type of shift working on a ward. But if you work in x-ray, the only things that are coming in are what the emergency room needs that weekend. You know, people coming in for fractured legs and ... So the emergency room will call you when they need you. Other than that, you do whatever your little duties are and then sleep. So that you wouldn't get that kind of shift in some place where, you know, there's constant work. You would get something like that, like at the fire department or as an EMT, where you're not getting, you know, you get some sleep time and that kind of stuff. We did that in Greece for a while they were closing out the base. We worked 24-hour shifts, and it wasn't bad. You know, you sleep when you got the time, you eat when you got the time, and there was time to actually do that. So anyway, let's go ahead and take a break. It's 9:25. Let's come back at 22.
Miss Mom,
Yes.
I remember my question.
Okay.
So, when you're a patient care tech, is there some kind of way you can work up under like a surgeon or work in a room with the surgeons? Because that's what I was really, really interested in. Either becoming an anesthesiologist or a surgical tech was really my interest.
Okay. Probably not. Again, you're going to have to pursue those specialties. So what does PCT do for you? Number one, it gets you a paycheck, a
Yeah.
steady, solid paycheck. So now you can enroll in that 2 to 4 year school
Mhm.
while not wondering if you're going to keep the same hours at Walmart or if HEB is going to let you take off time for a class or whatever. When you're in healthcare and you tell somebody you're going to school for something, you're going to get support because everybody's going to school for something. And if they're not going right now, they just finished classes or they're starting classes next semester. Everybody knows exactly where you're coming from. So this is not HEB where they're going to be like, oh, look, she just uppity, thinks she need to take off to just take some of the classes and shit. Why? Because they ain't doing shit. In healthcare, everybody's doing something. They're more likely to work with you to get that schedule that allows you to do school. So why do we call these, excuse me just a minute, why do we call these stepping stones? This gets your foot into healthcare. And now the directions that you can go and the support that you can get to go those directions. So what do? Get that job as the PC. Get that steady schedule. Then say, you know what? I want to work in surgery. And you know what you could actually do? Go up to the surgical section and talk to people. Hey, how you doing? Yeah, I work on the first floor. Tell me something. How did you get started in your surgical experience thing? Well, I went over to da 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 da. And you're more likely to be able to get guidance on how to exactly get in there. That's exactly what I did, guys. Walking through the emergency room every morning, taking a patient down to weigh him every morning, coming back going, man, this looks cool down here. So one day on my way out, I just stopped. Hey, what I got to do to work in here? I said, well, you got to be an EMT. You an EMT? I said, no. How do I do that? I didn't even know what EMT was back then. How do I do that? And he gave, they got a school somewhere here at the school, I think. And boom, started asking questions. Next thing I know, my butt was in the EMT classes. And it just took off from there. So they are getting in that environment, getting around the people that are actually doing it is going to push you in that direction too. So as I wouldn't recommend, and by the way, how many of y'all want to be nurses? I want to be a nurse. Put your hand up if you want to be a nurse. Don't be shy. Y'all know I don't like nurses, but put your hand up anyway. All right. If you want to be a nurse, do you know how competitive it is to get into nursing classes? They are so jam-packed. But when you walk into the interview process, there is an interview process for many nursing schools. When you walk in there and say, well, I'm already a PCT, where does your name go in the stack of applications? Up here. Versus those people who are walking in right off the street. So by getting this type of stuff, if you are pursuing, you want to be a nurse, you want to be a Remember what and people say this all the time too. Yeah, but the credits don't transfer. No, they don't. From PCT to RN, no, you're not going to transfer any credits. But what does transfer? The knowledge. When they do their medical terminology classes, this is you. This is everybody else. What'd she say? How did she say that? This is you. I'm good. When they do their vital signs classes, this is you. This is everybody else. How do you read this again? How come the thing won't stay blown up? This is you right here. So the knowledge and experience does transfer. So don't think that, let somebody convince you that taking a class like PCT or medical assistant is not going to benefit you going into nursing because the credits don't transfer. You're still going to have to do the vital signs class again. Yeah, but how are you going to do it? Like this. Like me in my med-term classes. Yeah, I had to take med-term classes after 20 years in healthcare. Well, I said, don't you have a test today or tomorrow? Yep, I'm good. It's just a midterm test. So school will be less stressful for you than the people just walking in off the streets. So there is transferable value. It just don't transfer it in the form of credits. The knowledge will go with you. So how would you do that? To make it long story, what it took me 10 minutes to answer your question. Tell me I can't talk shit. I'm not linguistic. So how would you do it? Get a job. Get the job. And then start saying, okay, what's the next thing on my list? Surgical something. Once I'm here, all right, go to that next goal and become a surgical something. Once you become a surgical something, okay, anesthesiologist. How do I get there? And you'll already be working with how many anesthesiologists when you get your surgical something? Surgical.
A lot.
Surgical doc. Half the people in the room going to be anesthesiologists. Hey, doc, how did you blah, 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 blah. Well, you should talk to Miss So-and-so down at da-da-da, and you already got that in. My favorite teacher was over at so-and-so. You should go talk to them. And tell them Doc so-and-so sent you. You already got that in. So that is a career roadmap. Looking at where you are, getting that goal done, moving on to the next one, getting that goal done and keep going. And eventually you will be that anesthesiologist. Any other questions before we can take a break? Can I take a break now? Can I please? Just a short break? All right. It's 9:30. Come back a quarter till.
Full like this much, I just add in the soap the whole time. It's filling up. Once it's like this full, I like go like that with the lid, so it makes it soapier. I just can like squish it around in there, and then I start throwing all the clothes in. Let it fill up. That's how I do it.
All right. I'm back. Okay, so career progression is going to take some effort on your part. Things are not just going to fall in place. You have to make them happen. If you're going to get, you got to go get. Don't let it just fall in your lap. Okay. So what I did, I was working the ward in a large hospital, working the male medicine ward, going through the emergency room every morning, dropping off one of my patients. I'll tell y'all about him next module. Y'all might remember from last module, Mr. Lefevre, the big guy, had to roll him down and weigh him every morning, coming back through the ER going, man, that looks cool. So I went down there. So my goal was I wanted to work in the emergency room. Okay. So I went down there and talked to the people. Hey, listen, what I got to do to get to work in here? Oh, you got to be an EMT. Okay. So I started doing my research. What the hell is an EMT? And how can I be that? And I found out. I had to go to the EMT class for 6 months, and the class was held from 8 to 1. So I went and talked to my boss. Hey, boss, I want to take this class from 8 to 1 for 6 months. Can you put me on swing shift or night shift so that I'll be free from 8 to 1 to take that class? And he said, well, I don't know. I'll have to look into that. And da, 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 da. This went on for about a week. Hey, boss, you think about that schedule yet? Well, I'm still trying to work out the da da da. So I went to the first sergeant. Shit. First sergeant, is there a job anywhere in this damn hospital where I can work and allow me to go to school from 8 to 1? First sergeant called the ward NCOIC, chewed his ass. The NCOIC called me and is all, you went to the first sergeant on me. No, man, I was just trying to find a place to work so I could take this class. Well, I'm going to go and give you a schedule, but, you don't need to be going behind my back like that. I don't give a damn. Just give me the schedule, slick. So now I got my 8 to 1 schedule, rolled into the EMT classes, got my EMT basic, went back to the emergency room. Hey, boss, I'm an EMT basic. Oh, well, EMT basics are ambulance drivers. We got enough drivers right now. If you want to work in the actual ER, you got to be an EMT intermediate. Damn. Went back to class. Another 6 months, 8 to 1. But the EMT I class, the intermediate, wasn't starting for 6 weeks. So I went back to the ER people. Hey, can I just volunteer in here from 8 to 1 for 6 weeks until my class starts? Sure, we can always use an extra pair of hands. All right. So now I'm volunteering in there for 6 weeks, still working that same swing shift schedule, up on the ward, going down here at 8 o'clock in the morning, volunteering for 6 weeks until my EMT I class started. The class started, 6 months, I'm back. I'm an EMT intermediate. And when I went in to put in my application for the ER, I walked right in the boss's office, dropped it on the desk, went to lunch, went down, got some breakfast, came back up, was going to volunteer a couple of hours. They'd already approved the application. They got approved in less than an hour. Everybody knew me and they were ready to have me there. So now I'm working in the ER. But wait, I want to go out on the ambulance. Gunshot here. I want to be the one jumping in the ambulance, going out there. How can I do that? You have to be EMTP, paramedic. Oh, okay, I know how to do that. That's a year-long class. That's all right. I'm already working in the ER. Next goal, work there for a year while I'm going to class. And guess what they did in there? They gave me the schedule. They let me go to class. And the whole time I'm working there, the paramedics are coming in, bringing in patients, headed back out, eating chips, having pizza, all that stuff. I'm right there. Hey, how y'all doing? Yeah, listen, I'm in the EMTP class. Oh, really? Hey, listen, I got this book that might help you. Who's your teacher over there? Da, 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 da. And these people are helping me out. Now I've got my MTP. Oh, hey, all right. I'm riding around on the ambulance, just having all kinds of fun out there in the world, seeing all kinds of crazy shit. But guess what? I want to be the boss. How do I do that? Well, since I'm an EMTP, I'm qualified to teach the EMT basic and the EMTI classes. Oh, so now I can teach. I go in and teach those classes on my own time. And when they saw me teaching these, somebody said, hey, you know, there's some openings over at the Combat Medicine Instructor School over there at Fort Sam Houston. Oh, so I can go teach combat medicine. So I did. 3 years later, people are screaming for me to come in and run their emergency rooms. This guy is an EMT teacher and a combat medicine teacher. We want him in our emergency room because our people are going to learn those things from the boss now. People were screaming for me to come in and run their shit. And I was traveling all over the country, all these different, going when somebody has failed their damn inspection, like in Greece, they send me. Oh, wait a minute. He's an EMT instructor. He's managing emergency rooms, 10 years experience, and he's a combat medicine instructor. Let's send Mahone over there. Plus, he's done HSI inspections. Let's send Mahone over there. He'll get the place straightened out. That's how you progress through your career. Small steps. And if you have to sacrifice to take that step, then you sacrifice. You get in there, you volunteer. You get your name on people's tongues. Who is that dude that's always around here? You know, that one guy. He doesn't work here, but he's always here. Oh, that's that Mahone guy. Well, let's try him out. Maybe he'll work out for us. Get your name on their tongue. So if you want to do that in the surgical route, you do the same thing. What if you want to be the person that's working in the cardiac cath lab, where you're putting the catheter in the vessels, drying up, finding the blockages, and cleaning out people's arteries and all that mess? You might start as a EKG technician. From there, you move on to, hey, we need somebody, you take the ultrasound classes. Next thing you know, you're doing cardio echo, sonograms of the heart. Then you move on to, okay, we need somebody up in the cath lab. Oh, this guy's an echo tech and he's an EKG tech. So you're doing stress tests now. You're around the people who work in the cath lab all the time. Hey, how'd you get into the cath lab? Da, 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 da. Next thing you know, you're working in the cath lab. So how aggressively will you pursue your career? Are you willing to take all these little steps, jump through all these little hoops? When I went and got my EMTB, and homeboy said, oh, well, you got to really be an I to really work in here. Damn. All right, fine. When the damn I class starts, shit, let me just get it done. And these little 6-month jumps, 6 months here, 6 months here, a year there, and boom, you're looking at, okay, how can I be the boss now? So be willing to take those little jumps as you need to. One step at a time. Don't go from the street to RN. That's going to be difficult. You go from the street to PCT, LVN, MA. You go from there to associate nursing degree. You jump from there to the RN, the bachelor degree. Oh, by the way, they're both RNs. Okay, so if you're pursuing RN, One thing you should know is that that's not a course or a degree that you can get by taking this class and then take that class and then take this class, like other degrees. If you want a bachelor's degree in business administration, for example, you take this class, you take that one. You don't have no money next semester, so you take the next semester off. You come back, you take this class, you take that class. Job won't let you go to school right now, so you take this semester off. You come back, you take this class and that class. You can't do RN like that. RN is a program where everybody starts and finishes together. So you can't take any breaks in there. And they recommend that you not work during RN classes, during the RN program. So how the hell do you do that? Okay. Don't jump right into 4 years. You're a PCT, you take the two-year RN program and come out of there with an associate degree. Once you finish that, now you're working a ward as a 2-year RN. Now you enter the bridge program, 2 more years. And that gets you your Bachelor's of Applied Sciences in nursing. Do it in increments. Jumping in the deep end of the pool right into a 4-year program that discourages you from working and might be too much to take on at one time. So do what's called a 2 and 2. And anytime you go to college, you should be talking to the college counselors about 2 + 2. In other words, if I go to school with you, after 2 years, I want an associate degree. And then I build on that to the bachelor's degree. My daughter didn't pay attention to this. And she went over to Incarnate Word. And she did 3 years at Incarnate Word. But when she finished at these 3 years, she did not have an associate degree because the courses didn't line up. Meaning that for an associate, you have to have this course and that course and this course and that course. She didn't take them like that. She just took the courses. And when she added it all up, it was not enough to equal an associate degree. She had more courses than she needed, but she also needed this course, and this course. She didn't take it. So as a result, she didn't have an associate degree. Tell your counselor to line your classes up to where when you're done with 2 years, you want to be eligible for an associate degree. And then you do the second half to bring you up to your bachelor's degree. She didn't do that. She just did courses. And she had some courses over here that she didn't need and courses over there that she did need that she didn't take. And nothing equaled up to an associate degree. So 3 years of school and she still did not have a degree. I want my courses lined up. I want to have 2. Now, do they want to do that for you? And are they going to do it for you if you don't ask? No. Why not? Because they want you in school for 4 years. If they let you get a degree right here, you may say, oh, you know what? I'm good right now. I got the degree. You might not do the other 2 years. So they're not going to do this for you unless you ask. They want to set you up to where you're going to be going to school for 4 full years, paying, blah, blah, blah. Even when they say they're nonprofit, like ACCD, oh, we're nonprofit. Yeah, but you pay, don't you? The teachers got to be paid somehow. The lights have to be turned on. So you're going to pay. So they want you in school for that full 4 years. They don't want to do this for you. So you're going to have to ask specifically. I want a 2 and 2. I want an associate degree after 2 years and then go on to the bachelor's degree. And you're already working as a nurse after just 2 years. So that is building on how you build on classes in college. Okay? You want a degree after 2 years. Even though you're going to continue to go to school, I want a degree after 2 years. And you're already working as a registered nurse. You're just a 2-year registered nurse, a 2-year RN versus a 4-year RN. Are you going to get paid a little bit less money? Yes. But you're already a nurse working the damn ward. So consider the second 2 years of your school. You're already a nurse. You're working the wards already. How easy are those classes going to be in those second 2 years? Cakewalk. And when everybody else is struggling, you're sitting at the nurse's station doing your homework until a call bell lights up. And then you can say, when you're sitting there doing your homework and the call bell goes, boo, you can say, you're Dell, go down to room 7 to see what Mrs. So-and-so wants. Because I'm the RN now. You're the PCT. Go down there and see what Mrs. So-and-so wants. And you sit at the desk doing your damn homework all night. So build on. Don't try and bite off too much more than you can chew at one time. Build on these things in small increments. All right. So let's now look at this thing. The resume. French for to continue, to resume. All right. You're looking for a job. Now, let me ask you first. Y'all just graduated Quest College. You got your certificate in hand. You just passed your certification test, all 3 of them. By the way, we do pay for all 3, but we only pay for the first time. So you do not want to fail that damn test. Because the second time, you're going to have to pay out your pocket. So you've taken all 3, and I advise you to take all 3. And now you're looking for that job out there. Hey. So which comes first? The job search or the resume?
Job search.
The resume.
The
Resume.
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 Job search. You want to have a resume ready. Just this blanket resume, just got all your skills and stuff listed. But that's not what you're going to send to the job. Find the job, and then you're going to tailor the resume to fit that job search or that job application or announcement. So if I'm looking for a job right now, and I want to send a resume over to Quest College, Lamson, Southern Careers, and College of Healthcare Professions. Each one of those schools will receive a different resume from me. I'm going to go to the College of Healthcare Professions. I'm going to look at their job announcement. I'm going to tailor my resume to fit that job announcement, and I'm going to save it, CHCP resume. Send it over there. Then I'm going to go to the Lamson job search, read their announcement, tailor my resume to fit it, save it as Lamson resume, and send it over to them. And I'm going to keep doing that for every job that I apply for. Why is that important? Let's look at a couple of job announcements. I'm going to go to Craigslist. Craigslist, San Antonio. That's fine. I want to go to jobs. All right, I'm going to go up here and let's type I spelled medical. No, I didn't. Medical assistant job. All right. Entry level office assistant job or medical office assistant job. Okay. Medical office assistant, San Antonio, responsibility, desired skills, high school diploma, self-directed, friendly and courteous, must possess excellent communication skills, strong planning, must be able to work well with staff, use consistent good judgment, ability to read and understand. Qualifications, they're just same thing. Desired skills, I just put the same list right there. That makes sense. All right. So, are they looking for any experience? Oh, they're looking for medical office assistants. Okay. Might be a place to start until you can find that medical assistant job. But you see what you want to do here? You want to go into your resume and you want to say to these people, I am self-directed. I am friendly and courteous. I do possess excellent communication skills. And you want to tailor your resume to fit what they're asking for. So you see how each resume will be different because each job will be focusing on a different thing. And you want to be able to say that I am that thing. Okay. So let's find a different. They're looking for, that's medical office. Entry-level billing coding medical assistant. Busy high volume chiropractic office. Person must possess great work ethic. Job duties apply electrodes, administer e-stim therapy, able to demonstrate blah, 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 blah. What are they looking for up here? Outgoing multitasker who is passionate about chiropractic and wants to make a difference in his or her community. To fill the following position, this key member of our team must be experienced, mature, punctual, bilingual in Spanish, and have a valid driver's license, and be professional. What we've been talking about all week. Be professional. Okay. Person must possess great work ethic with utmost integrity. Job duties apply, all these different things that they're looking for. Okay. Now, notice that this did not say, they said experienced, but they didn't say 2 years experience, 3 years experience in a chiropractic office. This is something I might apply for right out of school. Okay. And I'm going to tailor my resume to say that I am an outgoing person. I am a multitasker. I am passionate about healthcare, if not just chiropractics, and I want to make a difference in my community. Say that in your resume, and how can they fault you? This person is exactly what we asked for. Let's look at another one. Medical assistant bilingual, certified medical assistant. See,
Mr.
we got that
Mahone.
covered, don't we? Yes.
That on the chiropractor, that's probably a travel one, right? Like going to people's
It could be.
homes.
Yeah, they require a car. Yeah, it could be. They're asking for 2 years of medical assistant experience is desirable. You tailor this resume just right, and shit, they might want to talk to you anyway. Doesn't say mandatory, desirable. Bilingual preferred. So you do this just right, and this person might want to talk to you. Knowledge of medical terminology, basic medical assisting practice and procedures with an emphasis on taking medical histories and vital signs. Must be ability to respond flexibly to changing workload, develop, maintain good working relationships, communicate effectively. What are they asking for up here? Essential job responsibilities. Assesses, analyzes, and plans individualized care of patients. Takes medical histories, records vital signs, explains treatments and procedures to patients. Documents patient information, collects, prepares laboratories, and I won't go through all of them, but this is what they're telling you they want you to be. Certified medical assistant responsible for assisting by performing routine administrative duties, handling basic clinical tasks. We have an immediate open for certified medical assistants in the nephrology clinic, working with kidney patients. This is where, who said they wanted to work in dialysis?
Me, Melissa.
There you go, right there, man. You're working in nephrology. What steps are from nephrology to work in dialysis clinic? Knowing the right person. How many of their patients are actually on dialysis? How many times will you be called in the dialysis departments every day? There you go. That's your in right there.
Can I share some employment information since we're
Sure.
on the subject?
Sure.
The Vita Dialysis Center right now is hiring without any experience, and they're willing to train.
Hey.
Yeah, that's what I was thinking, Davita. Yeah.
Hey, you know what, guys? That's what we call networking. In other words,
University Hospital.
you know
Mr.
somebody.
Mahone,
Yeah.
I was going to tell you about, remember we were talking about the hours? Well, I heard at the DaVita that you can go in as early as like 4 in the morning and be off by
Right.
noon time.
I always say that
That's
about
correct.
I always say that about dialysis clinic. If you want to work a kind of schedule like that, get off at noon every day. They want to get dialysis done as early as possible in the morning because those people still need to go to work and go to school. So if possible, they want your dialysis done before 8 o'clock. So they often start as early as 4 o'clock in the morning. Some places, there's a place in Dallas that actually bought out an old motel, fixed it up, and they have their patients come in the night before. They stay there that night, and then they start their dialysis in the morning so that they don't have to get up and drive into the clinic at 4 o'clock in the morning. When they're done with their dialysis, they take their stuff and go home. They do that twice a week. They go right to work from there. They have showers and all that kind of stuff. So
Yeah, my brother does dialysis, and I get up every Monday, Wednesday, and Friday at 3 o'clock in the morning to get him out the door.
to drive them in there. Yeah, right. All right. So what if we were to create a resume for this position? Okay, let's pull up our resume. And let's start with the most important information on here, the name. Now, resumes are so different, guys. Everybody does them different. And if you try to go online and find a resume example, no two will be the same. What's important is formatting. Make sure that in your resume, there is some type of formatting, something to make it look organized, not all over the road. As an office manager, I want to look at this thing and I want to find what I'm looking for quickly. I don't want to read through paragraphs of this and paragraphs of that, trying to find out if you can take vital signs or not. Okay. So formatting is the most important part of what you're doing here. Make sure your name is the most important thing on the paper. Now, don't use resume paper or special font or borders or any of that mess. Plain old white piece of paper. Don't let anything distract away from what's on here. I don't want them looking at the parchment paper. I want them looking at my damn name. So get your name and credentials on there, your contact information. Now, there are some things that people tend to think is appropriate, but is it really? For example, is it obvious right here that that's an email address? So do I have to go over here and type email ... And over here in front of this, I type phone number ... That's taking up space. It's obvious that that's an email address, and it's obvious that that's a phone number. So people just think that that is professional to type email ... and put your email address, phone number ... and put your phone number. It's obvious those two are emails and phone numbers. And the first thing after your identification is going to be the employment objective. What is it that I'm looking for? So you're telling this person what your objectives are for employment. What am I looking for? And a sample would be, I'm an organized, enthusiastic team player seeking a position in an established medical office supporting physicians, nurses, and other medical staffs to facilitate patient care. All right. Now, this is where we start to tailor this shit. What are they looking for? Responsible for assisting physicians, nurses by performing routine administrative duties and handling basic clinical tasks. Do you have that in there already? We got lucky. We do. It's already in our resume. Okay. Anything else they might be looking for? What if they were to say, we need an organized person, an enthusiastic person. We need a team player in this position. This is where you get to put their words in your resume, and that's where you doctor it up. Now, seeking a position at, who are they? In a See if you can find the name of the company. It's over here, and they show where it is. So after doing a little bit of research, we find that this is San Antonio Nephrology Clinic. All right. Go back to your resume. And that's why it's generic right now. Seeking a position with San Antonio Nephrology Association, Associates. Okay. And take this part out. Boom. And we just tailored our resume. It fits. I want to work for you. I don't want to work in a medical clinic. I want to work for San Antonio Nephrology Associates. Tailor the resume. People like to see their name. They like to see the name of their company. So that's why the job search comes first. And I'm going to, when I'm done with this, I'm going to save it as San Antonio Nephrology Associates resume to make sure I don't send it to the wrong place. So go into my resume folder. There'll be 6 or 7 resumes in there already for the places that I've applied to in the past. Supporting physicians, nurses, and other medical staff to facilitate patient care. Writing the employment objective is probably going to be the hardest part of this thing. So how do you do that? See that word right there? Google. I almost wore my Google that shit t-shirt today. Google that shit, man. Go in here and type medical assistant, SSANT, employment objective. That's what I meant. Medical assistant resume objective examples. There they are. And there's one down here that says top 22 medical assistant resume objective examples. Let's check them. See what they got. Examples, Number 1, to gain employment with Highland Park Medical Center. Sound familiar? You want to put the company's name in there if you can. Where utilization of clinical administrative skills in an environment that benefits both patients and healthcare providers is a goal. That's a resume example or employment objective. Type it exactly like it is, copy it and paste it, or take this one because you like this part of this one and I like this part of that one. Providing superior administrative support. I might want to get that in here. So cut and paste these things. If this one says find a positive, a position with fully utilized attention to detail. Oh, look, I have a lot of attention to detail. I want to get that as part of this one up here. To gain employment, Highland Park, where utilization of my clinical administrative skills and my attention to detail skills or my attention to detail to benefit, blah, blah, blah. So take them and cut them and paste them in there. I like the way they say this down here. Interact directly with patients. I might want to get that. So I start taking stuff out of here that I like and some from each one of these and putting it together to mean me. Don't lie. I mean, you're not saying I have exceptional skills, so don't lie in here, but find stuff that pertain to you. As well as experience in administrative, dedicated. There's the word dedicated. Maybe I want to get that in there somewhere. Solving minor medical issues. I don't like the way they said that, so I won't use that. Passionate about providing top-class medical assistance. To obtain entry-level position. You might want to get this into your resume to let people know that you are right out of school. And there's a way for you to say that. to obtain an entry-level position. Highly skilled and motivated. I'm not highly skilled, so that would be a lie, but I am motivated medical assistant. This says extensive administration skills. I don't want to go with that, but I don't know. Challenging healthcare facility. Enormous nursing skills. That's not good grammar, so I probably won't use that. Applying for a position is saying knowledge and experience nursing functions. I probably wouldn't use the word nursing anywhere in my resume because I'm not a nurse. But you see how you can go through and find these things, guys. Just start with Googling it. If somebody says, well, you need an employment objective, medical assistant employment objective. Don't try to write it yourself. It's already been written. Okay? Just go in and take the parts that you want. And what if there was nothing in there? Oh, look down here. Top 10 medical assistant resume objectives. So try the different sites. You're going to see things in here done a little bit differently. Oh, cut it out, all this mess. I don't want your damn cookies. Looking for a medical assistant clinic where my enormous nurse, I think these are cut and paste from the other one. Enormous medical skills, the bad grammar. Okay, so anyway, you kind of see where that employment objective came from. Same type of language. Tell a little bit about yourself, what it is you're looking for. And this should be 1 or 2 lines. Don't get carried away with this thing. You're not telling your life story here. You're just telling them what you're looking for. If you can find the name of the company, include it in here. If not, then go with something generic, like looking for a position in a busy medical practice, as opposed to using the actual name. Okay, now what we're working on here is called a functional resume. And they're going to be different when we get to this point for skills and qualifications, because there's another type of resume called a chronological resume. This would be me. Y'all are going to do this one. I'm going to do that one. What's the difference? A resume always wants to focus on your strengths. And your strengths right now are your skills and qualifications and your education. Your job history is not necessarily a strength for you right now because you haven't worked in healthcare. So you would be focusing on these 2 things. But what about me? I've been in healthcare for more than 30 years. It is my employment history that is my strength. So right underneath my skills and qualifications, I'm going to start with my employment history. I've been working here, I've been working here, I've been working there. As a matter of fact, skills and qualifications won't even appear on my resume. Why not? I've been doing this shit for 30 years. Of course, I know how to do vital signs, phlebotomy, assist with I know all this stuff. And my work history tells you I know all this stuff. So I'm not going to bother putting skills and qualifications on there. I'm going to go straight to my work history. And that's chronological by time. I've been doing this a long time. People who are new to the field, they do a functional resume telling me that you do know how to do these things. And I did get the education. I haven't worked in the field. That goes down at the bottom. Now, what if you have worked in the field? Let's say you've been a CNA for 10 years, and now you're moving on to PCT or MA. You're going to do what's called a combination resume. This is somebody who does have experience in the field, but not in this discipline. So you're switching disciplines. You've been a surgical tech for 5 years. You went to school, you got a degree in nursing, and now you want to be a nurse. you're going to do a combination resume. And yours is going to be organized like employment objective, skills and qualifications, then your employment history and education. The order is up to you. Just know that each one of these areas should be covered. They're going to expect to see these areas in a resume. Okay. But for my resume, they wouldn't even look for skills and qualifications. They know I've been doing it long enough. Like somebody told me one day, it's like, Miss Mo, you know a lot about the human body. Well, shit, I've been doing it for 30 years. If I don't know a lot, that would make me the dumbest person on the planet, wouldn't it? Yeah. I've been doing this shit for 30 years, can't take vital signs, duh. How dumb are you? So anyway, your skills and qualifications. What are you going to put right here? Anybody? What are you going to put in here? I usually put it in a box like this. You don't have to. But what that keeps it from running down the page like that, and you're taking up half the page listing your skills and qualifications. If you insert a box like this or insert a table, you can type into those. And on this, the one that I sent you, all you have to do, you can just go right in there and change all this and type in your stuff. So it's like a template. Just go in and type in your stuff. So where do I get this stuff from? How do I know what to put here?
Things well, for me, basically, because I'm new to this, I would put the things that I learned at school that y'all would have taught me, like vital signs, phlebotomy. I'll be leaving with my EKG certification, things like that.
Okay. How about this?
But because my past history has something to do with the medical field, I wouldn't put the things that I have skills for, like handling a bandsaw, leveling a house. They don't need to know none of that. So I won't put any of that.
Okay.
You know, but I would put it in my work history so they can know that I can actually do physical labor and finish a project in a certain amount of time, because that would be a skill they'd like to know, but I don't have to go into detail for it. They should pick it up by my experience in the field.
Okay. Well, how about you just do this? Go back to the job announcement. What are they asking for over here? This is what they want to see in your skills and qualifications. This is what we want. Do you have this? So let's see. And assesses, plans individual care of patients. Okay, everybody should know that just coming out of school. I don't know if I would list that as a skill, but here we go right here. I'm online, that's right. Vital signs. I don't know. Okay. Go back to my resume. There it is, vital signs. Okay, what else are they asking for? And don't lie. If you don't know, just skip that one. Collect and prepares lab specimens, contaminated, blah, blah, blah. All right. Oh, look, collecting and processing lab samples. I'm in there. All right. Arranges exam rooms, instruments as applicable, equipment stocks, maintains supplies, and keeps waiting and exam rooms neat and clean. Collecting, processing labs, blah, 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 assist with minor surgeries. I might want to go ahead and put that in there. Okay. Preparing examinations rooms preparing rooms for examination. You know, sometimes people just say rooming patients. I want to put in there what they're asking for. Orders given by the physician. Review daily labs and contacts the doctor as needed. So I might go into here and where it says taking and recording, collecting and processing lab samples. Reporting lab values. In other words, contacting the physician and letting them know what the lab results were. Schedules patients to return referrals as needed. Taking recording patient history, electrocardiogram. I didn't put in here, but here we go. Appointment scheduling. Appointment scheduling. Administer injections. Already have medication administration. Triage incoming patients. Taking and recording patient histories. Maintains accurate charting, files paperwork, reviews charts, all that's recorded, patient history. Travels to satellite clinics, maintains confidentiality. There we go. HIPAA trained, maintaining confidentiality. CPR certified, OSHA trained, bloodborne pathogens trained, electronic medical records, keyboarding 30 words per minute, CLIA-waived lab testing, that's the same as collecting and processing lab samples, Microsoft Office proficient, report lab values, appointment scheduling. You have what they've asked for. And how do you know how to word it in here? That's what we help you with. That's what we're here for, the teachers. Bring that over. And we might say, instead of saying OSHA certified, you should say OSHA trained right here. Certified means that you can teach it to somebody else. Same with HIPAA trained. If you said HIPAA certified right here, that's a HIPAA teacher who's certified. So you would change that to HIPAA trained. That's the kind of advice that we give you. I don't want to see you doing things like, I don't want to on a resume see things like drawing blood. The correct name of the procedure is phlebotomy. Now you don't have to say performing phlebotomy. Phlebotomy. Electrocardiography. You see on some people's resumes doing EKGs. Well, what is that called? Electrocardiography. This is the type of stuff that we help you with. Your grammar, your verbiage, and so on. And now you have a lot of skills in there. 2 boxes worth of skills for them, but it's stuff that they find important. Let's go a little bit further. All this right here. Maintain accurate charting, filing paperwork accordingly, reviewing charts. This person is expected to be on the computer, aren't they? Well, here you go. I type 30 words per minute. It's not a medical skill. It's what we call transferable skills. Skills that are not healthcare, but they are useful in healthcare, like Microsoft Office proficient. You know, most of what you do is going to be done on computer today. You're either typing into an electronic medical record or you're doing their stuff in Microsoft Office. And if you can use Microsoft Office, hey, more power to you. If you can type 30 words per minute in a clinic today, shit, then you're not going to be the one holding us up because you're doing this. Back. The 2-finger typists out there. You're going to be out there typing my record. And maybe I'm going to think about that when I read this. That's the first time I've read this resume and I go, you know what? Yeah. Because people around here can't type, man. And I got somebody who can type 30 words per minute. Maybe I can use them. Somebody who's proficient in Microsoft Office. You see, because the day before yesterday, so-and-so called me back and said they can't open a program on the computer. And when I went to open the program, try and open the program for them, it wouldn't open. But then I looked down and saw that they had down here, they had 30 instances of the program running already because they don't know how to close a program when they finish. So maybe I want somebody who's Microsoft Office proficient. So if you have it and you think it might be helpful in getting that job, go ahead and put it in here in your skills list. Even some of those things that are not specific to healthcare. All right, so that's your skills list. How do you build it? Look at what they're asking for. Put that stuff in here if you have it. But also, if you just don't know what to put, there it is. Google that shit. Medical assistant, clinical skills. Patient care, vital signs, injections, CPR, EKG, phlebotomy, patient prep, life support, it's all there. And you can just build it from something like this. But again, don't lie. If you know you didn't do this in school, then don't put it on your resume. Just take the stuff that you know you did. All right. So is creating a resume becoming a little less of a mystery for y'all now? It's kind of simple when you think about it. The stuff is already made. You just have to organize it. So it's going to be more of messing around with this computer to get things to line up rather than trying to figure out what I should put in here. And that's what I mean by formatting. Things should line up. I'm having a problem with this right here. Y'all see the problem? I'm not going to mess around fixing it right now, but I wouldn't send it out like this. Why not? That dot is bigger than the other ones. And it's probably, I think I can fix it real quick, it's probably the font size. That's a 12. Oh, that's a 12 too. But I would mess around with that until all those dots were the same size. I would mess around with this until this and this were the same size. Even if I have to go over here and put in something else to make it all be evened out. Symmetry is really important for me. And you see another big dot popped in there. Even if I have to go back here, take this out, take that out, and try it again. To make sure everything is the same size. That's formatting. If you won't pay attention on your own resume, then what kind of work are you going to do for me in my patient medical records? If this shit is all over the road, this is the only thing they have to assess you right now, is this piece of paper. And if it's all over the road with misspellings and formatting issues and all that, then what kind of work are you going to be doing for me if you can't take the time to format your own resume? So I will go over here and I will think of something else to put right there so that all this lines up and looks symmetrical. So anyway, put a little bit of effort into this. So after your skills and qualifications, for you, your next strength is your education. I just came out of school. All this information is fresh to me. And so how would you answer that question? So, Miss Amaro, I see that you don't have any experience in healthcare. How'd you respond to that? Anybody, not just Roxy, anybody. How would you respond to that? I see you.
I would respond. I'm fresh out of school, so all my training is very, very fresh, and I just did my internship, so I do have some training. I don't have years of experience, but I have been trained under other professionals, and I believe in my training and the school I went to with my education. I just love the opportunity to help the community, help wherever you're at. Let's say it's a hospital. I just want to help Santa Rosa better their patient care, and I'd like to be the person to help us get there.
Well, sir, I did gain some experience on my externship. My education is fresh and new, and I bring no bad habits. I'm a blank slate. You can write me into what you need me to be. What do I mean by bad habits? Along with experience comes bad habits, shortcuts, da da da. You won't get those with me because I know one way to do it, and that's the way I learned. And I have no choice but to do it your way because that's the only way I'll know. In other words, I'm a blank slate. You can write me into whatever you need me to be. I bring no bad habits with me. So that's how you answer that no experience question. No experience also means no bad habits. Yes, who was that? Somebody?
Yes, I was gonna say, a lot of people, they do require experience,
Mhm.
but when you're fresh out of school, they like they like a lot of companies like to train you their way.
Yep. And that's what I'm saying. I'm a blank slate. You can write me into what you need me to be. You can, or I'm a lump of clay. You can mold me into what you need. And I will do it that way because it'll be the only way I know. I bring no bad habits. All right. So just now, they may be asking you that just to see how you answer it. It doesn't mean you're not going to get the job. I notice, Ms. Puente, you have no experience. They may just want to see how you answer that. So your education. First of all, it's assumed that you're a high school graduate. Okay. But you can put it on there. But you're going to put your highest education first, and that's going to be your Quest College. Put the date that you graduated and the certificate or degree that you obtained. So you see here, you went to Quest College, you graduated January 2019. This formatting got jacked up when I saved this somehow. So I'm only going to try and correct this a little bit while we're talking. Remember, I am a stickler on formatting, y'all. Okay, so that is your Quest College. I do have NRCMA, even though you mentioned it up here. You can go ahead and put it again. I got these certificates. Okay, now what about your high school? John Jay High School, graduate, high school diploma, period. Don't put the year, just that I am a high school graduate. Why don't you want to put the year right there? What year you graduated high school?
Because that leads them to ask questions why you weren't in school, what you did between that time. Nope.
I was gonna say they don't need to know my age. I'm just kidding.
No, that's it. That's it. Exactly. Your age is none of their business. And if you put your year you graduated high school, then it implies, or it alludes to your age. So no, your age is none of their business. So don't put anything on here that might indicate, that might age you, if you will. So for your high school diploma, just boom, I did graduate high school and I do have a diploma. As a matter of fact, you could also do this. High school diploma. I have one, yes. You don't have to put the high school you went to or the state you went to high school in. You just put high school diploma. Yes, I do have a high school diploma, is what you're telling me. All right, so Quest College graduate 2019, NRCMA, NRPCT, and EKG. And I do have a high school diploma. All right. Now, what if you have an associate degree or a bachelor's degree right now? Highest education goes up top. Not the latest, the highest education. So you have a bachelor's degree, you would list that first. Then your Quest College, then your high school, regardless of when you got either. The highest education goes first. Now, once you have a bachelor's degree, an associate degree, or any type of college degree, you don't list high school anymore. You never have to put high school on your resume anymore. Okay. And that was one of the reasons that I really wanted a college degree. One of the reasons was that my resume would continue to say GED. Not that that's bad, but it will continue to say GED because I don't have a high school diploma. I have a GED. So I wanted to get at least one degree on there so that I could drop high school altogether. And once you do, high school won't appear on your resume anymore. Now, what if you've taken classes that you think might benefit your chances to get this job, but you didn't get a degree? You can list those classes. You can go right down here and you can do St. Philip's College. Da, da, da. St. Philip's College. Did I spell college right? Yes. 30. 30 English credits. That should be capitalized. 30 English credits. 6 math credits. Whatever you got that you think might benefit getting this job, if you've taken those classes, you can go ahead and put those right there. Because you didn't get a certificate in it, and since it's not a diploma, it would be your lowest education classes that you've taken. All right, your employment history. You typically want to take your employment history back 10 years. And you know what? Let's take another break before we get into the employment history. It's quarter till. Come back at 11 o'clock. Okay. So your employment history, take it back about 10 years. And, but let's say there's a job that you did 11 years ago, 12 years ago, that might show them that you have some skills that are valuable to them. Then you go on and list it. Go on and list that job. But take it back about 10 years or so. Okay, now I focused on jobs that were not in healthcare and how you would write that stuff. Okay. For example, Toys R Us. Is that the name of the company? That's exactly how they write their name. So that's how you would write it. You wouldn't write it as Toys A-R-E Us. No, the company name is Toys R Us Incorporated. That's why I use that one. And what did you do there? I was a customer service representative. Try to think of a name that for the job you did that is professional. For example, if you worked at McDonald's, you wouldn't say you were the fry guy. How could you say that you were the fry guy and make it sound more professional? Any ideas?
Cook.
Cook. Chef. How about food prep specialist? If you're only doing one thing, doesn't that make you a specialist? Yes. So if all you're making are the fries, then you are a fry specialist or a food prep specialist. It's why somebody who's a cook might call themselves a chef. Somebody who's a groundskeeper might call themselves an exterior decorator. In the Air Force, you might be an aerospace ground technician. What do? You sweep floors. You see what I mean? Try to find a way to say it that gives a professional twist on it. Customer service representative. Or customer service, what do they call those people at Walmart? Associates. Customer service associate. Okay. And then if there's something that you did there that attests to what they're asking for, you would put the responsibility down here. Ensure quality customer service for approximately 100 customers per day. Now, didn't over here in this job announcement, didn't they ask for something about assesses, analyze, plans, individual care plan, patients, documents, collects, arranges, reviews, schedules, administers, triage, maintains, files, reviews, travels, maintains, confidentiality, completes other duties as assigned or directed by the physician, supervisor, or manager. Yeah, I'm gonna go on and leave that there. Yeah, I'm a customer service person, man. I can get out there and I can talk to your people. And I can talk to them professionally. And you're not going to have me at your front desk saying, I'm going to kick 100% of your ass. Remember that? Yeah, I've been out in front with patients or with customers. And I know how to talk to customers. Okay. And then the year you started, month and year. And in this case, you're still working there. November 2017 to the present. Okay. And then the job previous to that, I worked for Burger King Incorporated. For Burger King, I was a cashier. I'm gonna take all that, make it the same. It was 8, right? Yeah, 8. Oh, wait a minute. No, I'll make it all 12. I was a cashier. Did I spell cashier right? Is it I-E? All right, thank God for spell check. All right. And I was there from January 2013 to February 2014. And I take great pains to make sure that all of this lines up over here. That's formatting. Okay. Making it make sense. Not having something like this. You go, wait a minute. They couldn't take the time to line that shit up. So how are they going to be writing in my medical record? I'm going to be getting crap like this. So I take great pains to make sure that all this stuff is lined up over here or justified to the right, if you will. And that 2019 isn't justified. Let me move that a little bit. Do it until the 9 disappears and then back up where it's all justified. Do the same thing over here. And some people know how to use the buttons up top to justify right and left and all that. I just space it over there as long as everything's lined up to the right over here. Now notice my box isn't, so I'm going to line that up and get everything lined up and justified. That's formatting. Make sure you're doing that. Okay. Now, do you notice a issue here with the employment dates? Because I'm going to ask you about this if I see this on your resume. During the interview, when I'm looking at your employment, there's a question I'm going to ask you. Does anybody see it?
The gaps between employment.
I'm going to ask you about the employment gap. I see you worked at Burger King from till 2014, and then you started over at Toys R Us in 2017. Can you tell me what you were doing during that time? It's not bad. I just want to hear. I want to hear what you've been doing.
Mr. Malone.
Yeah.
I wanted to ask you, because I noticed that employment history.
Mm-hmm.
I mean, if it doesn't refer to the type of job that I'm seeking, like, is it necessary that I put all that stuff, like fast food restaurants or retail and stuff like that?
Yes, because it shows an employment history. Well, let me finish this. From 2014 to 2017, what were you doing? Were you in jail? Were you a crackhead? What were you doing during that time? Okay. You might say something like, I was in school. Or I had to leave the workplace to go take care of my mom. That commitment is fulfilled, and I re-entered the workplace. So just be able to explain the employment gap or the employment gap. Don't worry about it being there. Just know that employer is probably going to ask. So what were you doing for those 2 or 3 years? Now, as far as listing all your jobs, yes. Why is that important? In one class, I was sitting in the back of the classroom while the teacher was teaching in this class on resumes. And I'm just observing and taking notes. And one of the students asked, well, Miss So-and-so, I worked at Burger King for 3 years. That's why I put that here. I worked for Burger King for 3 years. How do I put that on my resume? And she said, you don't. No, I'm paying attention. Oh, really? And she told the student that it has nothing to do with healthcare. Therefore, I don't want to see it on the resume. Really? Now, after that class, I had a talk with that teacher. I said, why don't you want to see Burger King on their resume? Because it doesn't say anything about healthcare. It has nothing to do with healthcare. And I said, well, you obviously have never heard of transferable skills. Skills that have nothing to do with healthcare, but they're still valuable in any workplace. And that's what this shows. Anybody ever worked in a fast food restaurant? If you have, then you probably know they're not going to put up with your bullshit for too long. Are they?
No, I was a manager there. I was a assistant manager, and I didn't put up with none of that.
No. So if you survived at Burger King from 2013 to 2014 or whatever, 5 or 6 years, what is that telling me about you? You can come to work. You can follow a schedule. You can dress appropriately. You can work with other people. You can work with customers. It tells me a lot about you. Even though it had nothing to do with healthcare, those are things we want in healthcare, aren't they? We want somebody to show work on time. If you're not showing to work up time, if you're not showing to work up to work on time at Burger King, how long are they gonna put up with that mess? Not 5 years or 3 years. If you're not coming in dressed appropriately, how long are they gonna put up with that? Not very long. And if you can't look at a duty schedule and know I'm supposed to be here on Wednesday at 3 o'clock, and you keep missing shifts, how long are they gonna put up with that? If you're not getting along with the other people that work there, how long are they gonna put up with it? Not for 3 years. So it tells me a lot about you, even though it has nothing to do with healthcare. We call them transferable skills. And that lady still didn't get the message. Well, it still wasn't in healthcare. So what do y'all think we had to do? Gomer,
I
you're
hope, there is a training program for hiring managers, because when I owned my own business, I was the only person in the office. So that allowed me to tweak my resume in the future. Now I tell them I was the office manager. I did everything there. That gave me that kind of.
And unfortunately, many of our office managers do not have the benefit of that type of training.
That's not good.
Yeah. So that lady who was teaching that class had never had office manager training.
Yeah, and I was taught that when we look at someone's resume, we have to ask the question about the gap in the employment. And for the same reasons you said, are they accountable? What kind of person are they? Why aren't they working? Do they not like to work? And is that something that you can, as a manager, accept and hire them, and still know that you can possibly have a really good employer-employee relationship after that? So that's really important. That's one thing I did learn about a resume. Was when I went to that training.
Now that lady, when she put on an employment application to be hired as a teacher, she put on there that she had human resources training. Now remember what I told y'all? It'll all come out in the wash. If you're lying about something, somebody's going to figure it out. And you're going to tell me you had human resources training, or you worked in human resources, and you don't know what transferable skills are? You lied on your resume. You don't have human resources experience. And that's one of the reasons that we just went on and parted ways with her, let her go, because there's no way. And if we knew she would be teaching resume classes and that type of stuff. So when we read her resume, it was like, oh yeah, look, she's got human resources. Yeah, she'll be good in the resume part and all that. Turns out she had no idea, because she lied on the resume. She had to. Okay. So now, what about if you were a cashier at Burger King? Responsible for $25,000 worth of company assets. Is that a transferable skill? Hell yeah. What is it saying about you? Reliable, trustworthy, honest. The things that we've been talking about all week. And it says it right there. Even though it appears to be nothing to do with healthcare, but it does say a lot about you, what kind of character you have. Has anybody worked for a place and they ask you to lock up before you leave? How much company assets are you talking about? It's a Burger King. How much is the building worth? $1 million? What about the stoves in there? The cash registers, the tables, the chairs, the little screens up there that tell you what the menu is. All of that is company assets, and you're responsible for securing that? That's hundreds of thousands of dollars worth of company assets that you're responsible for. And all you're doing is locking the door before you go home. But here's the kind of people we don't want. When Quest had the cosmetology school over at the Rim, I had to drive over there one morning. Actually, I was going over there to let a teacher go, but I had to drive over there, and I wanted to be there right when they opened. So I got there at 7:30. I was the first one there. The door was unlocked. It was a Monday morning. That door had been opened all weekend. See, that's the kind of people we don't want. Door was unlocked all weekend with nobody in the building. That's the kind
I
of people.
take it you fired 2 people then?
Nah, I just let that. I was just there to let that one lady go. I let the school, the president of the school handle that. Yo, I was the Quest firer for a while. Yeah, you know, the corporate firer. Yeah, when Mr. Mahone walks in, everybody's gonna go, "Oh shit, that Mr. Mahone. Who is he coming for?" Yeah, when I was first hired, I was the company firer, and we had a lot of people to get rid of. This school was in bad shape. So anyway, so these are things that, again, have nothing to do with healthcare, but they do say a lot about you. And I'm trustworthy. You can see it right there. I have good customer service skills. You can see it right there. Nobody's going to see 100 customers a day if they don't have good customer service skills. Otherwise, they've been gone a long time ago. So, and y'all know the kind of stuff I'm talking about. You walk up to somebody, you see them in Walmart, they got "Can I help you" on the back of their jacket or their vest while they're walking away from you. Can I help you? You call one of them, they start walking faster. Or that person that just comes over and just like, listen, do y'all have any of these? No. You ain't even checked? No, we don't have any. They ain't even checked. So, but anyway, or the Spectrum people. What cable do you have, man? You don't get out of my face. Anyway, so that is a resume. Keeping it to one page as much as possible, but I cannot get my resume on one page. It's not going to happen. So I keep mine to 2 pages. So that one page is not written in stone. Get everything you need on there, but don't be going 3, 4, 5 pages, that kind of stuff. I would say 2 max. If I can get my resume on 2, anybody can get their resume on 2 pages. Now you notice I did not go down here to the bottom, which people like to do, and type in references available upon request. That's a gimme right there. If they're asking for 3 references, I will either give them or I won't. So I'm not going to go down here and waste a line of text. Now, looking at this, I would look and see, oh, I got some space down here. What else can I put in here? Can I go up here and expand on my employment objective? Can I go in here and add some more skills? Can I bump up education a little bit? Can I add a couple more jobs that say something about me? So I've got a little space down here. I'm going to use it for something effective. I'm not going to go down here and type references available upon request. That's a wasted line. But you see people do it all the time. So I'll go up here and go, well, wait a minute. Maybe I can get into here a little bit more. Or maybe I can go in here and make the font a little bit bigger. I got to take all of this and try to bump it up in size a little bit. Help it to fill up to the bottom of the page. Now 12 to 14 would drop it off on the bottom. So I got to keep it at 12. But what else can I add in here? Okay. All right, so y'all have a copy of this. Use it as a template. Remember up here in your employment objective, that's the hardest thing to do, and it's going to take you the longest time. Think of something that says something important about you. I am organized. I'm enthusiastic. I'm excited about my obtaining my first job in healthcare. You can say that kind of stuff. An organized, enthusiastic team player who is excited about their first, searching for my first position in healthcare. Just bump it up a little bit. See what other people are saying out there and use their words, their language. And that's the best way to keep your grammar correct as well, by the way, is to cut and paste it from someplace else where it's already been thought through. All right, so that's your resume. You have an example of it. Go in, doctor it up, start making it, start typing your stuff in here. Many of it can actually stay the same. If there's a skill in here that you want to add, you can take one of these out, put a new one in there, whatever. But because you're saying that you are phlebotomy and EKG certified or trained, I think I want to go on and keep those in there. But find something in here that you might be able to change with something else or whatever. And just kind of use this as a template to type over. All right. And you already have that. Okay. So that's your resume. You got it ready. You got one for Kellum Clinic. You got one for Texas Med Clinic. You got one for nephrology or whatever. And you got them bad boys out there. Okay. Now, let's talk a little bit about your email address. Create you an email address that contains your name. Email addresses are free. You might want to create one just for your job search. And when you get that job, delete that address. But get one that has your name in there. And you don't want your job offers going into your group email that you get email with everything else. Because how many times have y'all deleted an email without reading it first? And you go, oops, oh man, I wasn't supposed to. So get you one that only the job responses are going to go into. Go to Gmail and start you a new one. rmahone at g992@gmail.com. And only your job searches will go into there. I've gotten emails, guys, that you would not believe on people's resumes. One guy sent out, and I've got to just got to believe that this was a mistake. He put the wrong email in there, or it auto-filled and he didn't notice. Because sometimes once you put an email and you start typing, it auto-fills into the document. It must have, because that email was pussyhound@something.com. I'm like, really? That had to be a mistake. Don't make those kind of mistakes. And check that email a couple times a day. Your phone number. This is going to be a time where you're going to have to answer the phone, whether you recognize the number or not. How many of y'all do that? I don't know who that is. I'm sorry. During this time, you're going to have to answer the phone. And you're going to have to do it professionally. If your homie calls you and you pick up and you go, yes, this is Yordale Castillo. Can I help you? And they go, really? Hey, I'm looking for a job, man. Sorry. That's how I answer the phone right now. Okay. I'm not going to be calling you from Quest College and you going, hello, or who this? Whatever. How you going to be answering my damn phone at work? Who this? So anyway, you're going to have to just adjust while this is happening. Be prepared. The message, just in case you don't answer, you need to take all that bullshit off. All the dot to 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 woo dot to dot to dot to. I'm like dot to dot to dot to dot. All right, next number. I'm not going to sit there listening to your music for 5 minutes, waiting to leave you a message. And you definitely need to get rid of that one. Hello. Thought you had it. Yeah, I'm gonna hang up. I ain't got time for you. All right. So go with the message that comes with the phone, or record you a professional one. This is Talisha Brooks. I'm not able to come to the phone right now. Please leave a message and I will contact you as soon as possible. Leave a professional message. So that's a little bit about your email and your phone message. You have something professional. Don't have these people calling up and you hot girl at whatever.com. I might call you for a date, but I'm not going to call you for a job. You're hot girl. All right. All right. So anyway, that is your resume. Start working on it, getting it doctored up, whatever you need to do. Don't be the last one. In other words, when Miss Zapata calls you about or comes to your class about a month before you graduate and say, I need a resume for everybody, what you should be saying is, I'll bring mine in first thing tomorrow morning. Get yours on the top, because guess what they're going to get? The choices positions, the choices externs. And yes, you're going to need a resume for your externship. So they'll get the choices externships because their resume was there and ready to go. You bringing yours in at the last minute, you get what's left. So when they ask you for a resume, that shouldn't be the time you go home and make it. You should have been making it all along. Remember, these things take time. It's not something that you want to do in an hour. You want to take a day, create it, set it to the side, think about some things, because you'll be driving the car down to Walmart and go, oh man, I should have put this in there. When you get back, put that in there. So start it now and get it ready. All right, so you got your resume. And this person finally calls you on the phone. Hey, Robert. Yeah, this is Mr. Jones down here at the San Antonio Nephrology Associates. Listen, I got your resume, and I'd like to talk to you. When can you come in to see me? When can y'all come to see me?
At your earliest convenience.
Okay. Well, first of all, you get this tennis match going. If he says, when can you come see me? What you're saying is, when do you want me to see you? And he's saying, well, what's appropriate for you? Well, when do you have time? So you don't get this tennis match going back and forth. He says, when can you come in and see me? I can see you this morning or this afternoon or whatever time is convenient for you. Well, I've got an appointment this morning. Can you be here at 2:00 this afternoon? And unless you really cannot, you would say yes. And what I mean by that, and how would you say, if they say, well, can you see me at 8:00 tomorrow morning? How could you say no? What's the best way to do that?
Say you have a prior engagement that you can't get out of.
Well, sir, unfortunately, I do have a commitment tomorrow morning at 8:00. Is there any way you can see me a little bit later? And say, well, what time is your commitment done? I'll be done by 10:00. Can you see me at 11? Yes, sir. So you just used up your one. The next answer will be, I will be there. So if they say, can you see me tomorrow morning at 8? Without going into detail, unfortunately, I do have a commitment during that time. Is there any way you can see me a little later? I can see you at 3:00. I'll be there. And if you got something going at 3:00, you need to change that shit and have your butt over there at 3:00.
Sir, I have a question. Okay,
Yes.
I do have experience in a few of the stuff that we're actually learning. I let my certification expire. That's pretty much why I'm doing this again. But I was like, for that factor, you know where I get confused at? When they ask you about like, I know I can't hear. When they ask you about like, how much do you think you're like, basically how much do you think you should get paid?
We'll get there. We'll get
Okay.
there.
That's the biggest one I always have.
That's when we get to the interview. So he's called, and you've set that interview up for tomorrow morning at 8:00. What can you do tonight to prepare for that interview tomorrow?
You look up the average pay for your field so you can have some negotiation ground. And then you definitely want to prepare like all your clothes and all of that, because you don't want to be stressing in the morning,
Now
running
remember-
around. Get it all done.
Okay. Remember too, guys, that this is not an interview at HEB or Walmart or Burger King. So typically you're not going to get this job with one interview. There will almost always be a second interview. The first interview narrows it down to 1 or 2 people. The second interview is what gets you the job. So the first interview, they're usually not going to ask about salary, but just in case they do, have a number. And I usually would give them a range. For example, if you went online and you search the average salary for medical assistants in Texas, they'll give you a range of something like, why isn't, I'm online again. They'll give you a range, something like
Like 30.
12 to 15 per hour. And that's what I would write on my resume or on the job application when they ask, well, what is your desired salary? $12 to $15 an hour.
And I like to look up the company. That's a good one. You should know something about the company. What is their stats and what do they do there? Because I know a lot of times they'll, like Indeed, they'll just send you like, oh, it's over here. If you don't know nothing about them, they cannot stand that. Like, what are we here? What do we do? What kind of patients do we see? That's like the best thing when you know something about them, because it shows that you're actually interested in the company.
Well, when you're doing your job search, I mean, wouldn't you look up the company then? I mean, that would help you with your resume and everything else, looking up the company. So I would assume you'd kind of know a little bit by then, but I mean, I would refresh.
Okay. So how can you prepare? First of all, look up the company. All right. And what you're looking for is something called their, I'm back online again, something called their mission statement. It's every company will publish a mission statement saying our focus or what we're here for. Now, I'm not saying you have to memorize it, but get some pieces of it. So when they ask you that question, so Mr. Mahone, why do you want to work for Quest College? Well, sir, I've always wanted to work at a place where I could provide career focus, make career focus education accessible to all individuals. Use their own words against them. This is not actually Quest College mission statement. Let's see if we can find that. Quest College mission statement. Quest University, mission about us, mission statement, MedQuest, history, Quest Center, mission statement, Quest Forward. Unfortunately, Quest is such a common name for things.
It's usually under the About Us. So
Under
if you
the
go back to the
Quest College.
Yeah. And then click About Us when you go back to that home page.
Oh, there it is up there. Hours of operation, who we are. There's a mission statement right there. Thank you. Quest College is a college of higher. I've always wanted to work at a college of higher education that offers quality educational programs to provide career-focused training to students. And then what can they say next after that but next? Why do you want to work here? I just used your own mission statement against you. So read that company's mission statement. So why do you want to work here at this clinic, Mr. Mahone? Well, I noticed that on your website that you're servicing about 300 patients per day. I thrive in a high volume environment like that. I enjoy the fast pace, the high volume of patients. Use that stuff against them. So you want to look up the company. Can you go there tonight? To the company tonight. And why would you want to do that? Your appointment's tomorrow morning. Can you go tonight?
So you won't have an issue of getting lost.
You know how to get there. You know where it is. You know where to park. You know where the parking costs money. How long it might take you to walk from where you park to the building. You might go by there, man, the building's way over there. Man, I better get here early because it's going to take me about 10 minutes to walk that far. And get all that kind of stuff ironed out. If you get over there and the building is still open for the day, can you go in the building? Sure, I'll walk up and introduce myself. How you doing? To the front desk. How you doing? My name is Mr. Mahone. I have an appointment here with Mr. Jones tomorrow at 8 o'clock. Am I in the right place? I just want to check and make sure I'm in the right place. Do that kind of stuff. When they invite you for the interview, can you ask them how they prefer you to dress? Yes. Yes, sir. I will be there at 8 o'clock tomorrow morning. Can I ask what type of dress do you prefer for interviews? Because if you ask me that, I'm going to tell you to wear what you plan to teach in. Yeah, I want to see you in what you plan to teach in. Because, see, I don't want you coming up in here in your Sunday best, looking all pressed and good and all that. And then when I hire you, but you come out here to teach in wrinkled up scrubs. I want to see you dressed in what you plan to teach in. You can research the company. You can go by the place ahead of time if you can. You can Google interview questions. Tell me about yourself. How did you hear about this position? Why do you want to work for this company? You're nailing that one already, aren't you? Well, I've always wanted to work for a place that provides high quality education to students to help them achieve their education goals. Oh, damn. Okay. Next question. Why do you want this job? Why should we hire you? What are your greatest strengths? What are your greatest weaknesses? Da, 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 da. You know the hardest one in this list to answer? Tell me about yourself. So, Talisha, tell me about yourself. And then you start in with, I got 3 kids. I've been married 5 years. No, we don't want to hear all that. Okay. Tell me about you. Okay. You might want to start with, I'm a recent graduate from Quest College, and the reason I got into healthcare was because I've always wanted to provide assistance with people. I just always want to help people. You practice it a little bit. I've always wanted to help people. And that's why I got into healthcare in the first place. Don't restate your resume. Just tell them a little bit about yourself. Can you say that I was born and raised in San Antonio? Yep. I have connections to the community. Yep. Can you say that, can you say this? Can you say, yes, I was born and raised in San Antonio. Go Spurs. Can you say that? Yes, you can. Especially if you see a Spurs picture hanging on the office wall in there. Or you see a Spurs football or a Dallas Cowboy football helmet sitting on the desk. Yes, I was born and raised in Texas, and I am a Dallas fan just like everybody else. You can say that kind of stuff. I wouldn't get like totally silly with it, but just real quickly, like, yep, put that plug in there. Yeah. Can you say, I was born and raised in Missouri, but I got to Texas just as fast as I could? Kind of lighten it up a little bit. There's no problem with that. Just don't be that total joker. But yeah, you can throw a little levity in there. Just don't get carried away with it. I've always wanted to work in healthcare. This will be my first job in healthcare, and I've always wanted to provide the customer service in a healthcare environment. So that's the hardest question to answer. You're going to have to practice that one a little bit. Tell me about yourself. Most people have difficulty doing that kind of stuff. But don't start talking about your kids and how long you've been married, because that's none of their business. None of their business that you even have kids or that you are married. Okay, so Google interview questions and practice these with somebody who is going to be serious with you. If your interview is in a couple of days, they'll come by to school. Say, hey, Mr. Mahone, I got an interview on Wednesday. Got any advice? And I might set you up with somebody to do a mock interview there at the school.
Mr. Mahone,
Yes.
I remember I did an externship for my MA back in Cali, and they can do interviews when they do the externship. They don't.
They will.
I don't know.
They will.
And they kind of made me, I was caught off guard because I wasn't used to it. So I was expecting them to start asking me all these medical term questions and this, that, and the third. And it got me so, I was like, huh? She's like, well, what's such and such and such and such? And, you know, I'm thinking she's going to ask me totally about what's going on. And she started throwing medical terms and knowledge at me. It freaked me out a little bit. And I had to catch myself. And you could tell it was freaking me out. And it, yeah. Do they usually do that with, because I'm pretty sure you've done interviews with people.
No, that's not an interviewer. That person doesn't know how to do interviews. No, you don't test knowledge during an interview. Okay, that's professional. You see, if you have that certificate, you have the knowledge.
Of course.
So I'm not going to test your knowledge during a damn interview. That's why you would never be asked to do something like draw blood for me, so I can see your blood drawing skills. No, we don't do that. Okay? This is not about knowledge. So you shouldn't be asking knowledge questions during an interview. Okay? If you want to do that kind of stuff, then you could actually schedule a pre-test so I can see where your knowledge skills are. But you don't do that at an interview, no. All right. So come over to the school and I'll set you up with a mock interview with somebody that you don't know. One of the admissions reps that's not your rep, or maybe even set you up with Miss Martin, the owner of the school. She does that sometimes. Hey, Miss Martin, I got a student, got an interview next week. You want to run her through the ringer? Sure, Mr. Mahone, I have time to do that. Yeah, you get to go in and sit down with Miss Martin and answer her questions. Have fun with that one. Anyway, yes.
Is there any way that on our resume we can do that at the school, and someone can help us like with the computers and stuff and use the printer, because I don't have that.
Yeah, you can go to the school and use the computer at any time. This building is open till 9:30. So anytime between 8 o'clock and 9:30, you can use computers over there. Now, in the evening, you're less likely to have somebody who can come around and help you. But during the day, there's all kinds of people who can help you get things printed and that kind of stuff. So, but yeah. And remember, during the COVID thing, the building's not totally locked down, but you'll have to wear a mask and stuff like that while you're in there, of course. But yeah, you can use computers in the building at any time. That's why we have a computer lab. And there's a printer in there and all that kind of stuff for you to use. Okay, so tell me about yourself is probably one of the hardest ones to answer. Tell me about something that you're particularly proud of. And people always want to jump on their kids. Well, I'm proud to go to school and complete college. Yeah, it's an okay one. You know, when they asked me that, and that was for a quest. And when they had already decided, when I'd already told them about blah, 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 and they got the wrong teachers in the wrong place, we need to be doing multiple certifications, blah, blah, blah. Then they wanted me to interview with each of the department heads. And the lady, the one I told y'all who quit the day I was hired, she had to interview me. So I'm sitting up in the room with this woman. If I had just told them that she set this program up wrong, or was poor organization of the program, and then I had to interview with this lady. And you could tell she wasn't into it. She was just like, okay, so Mr. Mahone, tell me about something that you're proud of in your life. You know, President George W. Bush went on television during the Desert Storm activity and stated that we had minimal casualties during that engagement because of the excellent training that our medical professionals received at Fort Sam Houston, Texas. That was my unit. There's only 10 of us. The President of the United States just mentioned one of the smallest units in the military on television. And that was me. Y'all should have seen me. I was dancing in the living room and she's like, hey. My wife's like, sit down. I was like, no, President just said my name. He didn't say your name. Well, he just might as well have. There's only 10 of us. That's when I was teaching the combat medicine classes over there. There was only 10 of us doing that training in the world. And the president mentioned us on TV. And she was like, okay, next question. Yeah, shut you up, biatch. You knew she didn't want to be there because I'm replacing her ass. Get interviewed by the person that you're replacing and see how that interview goes. But anyway, so So, Miss Mahone, tell me, what is your greatest strength? It's a stupid question. Nobody should ask it. And the only reason they're asking it is to see how you answer it. So here you go. Take you into here. Take you into here. And find, oh shoot, what am I looking for? Oh, S. Okay, it's not there. So let's look in here. Why is it not there either? Where did I put it? Oh shit, I have so much stuff, y'all. It's not in there. Let's go up here. See if it's in here. It's not in there. Let's go. I'll see how much crap I have in here. I have everything, man. I don't throw nothing away. Where the hell is it? Okay, let's do it this way then. I don't know if this is the same thing or not. This Clifton Strengths Finder, and oh, fuck off! I don't even want to go in there. There it is. This is not the one I usually use, but it's the same one. It's just not the site that I use. All right. So anyway, Strengths Quest, Strengths Quick Reference Guide. Okay. So, Mr. Mahone, tell me about your strength. What is your greatest strength? Well, sir, my greatest strength is that I'm an achiever. And then you explain that a little bit. It says here, people strong and achiever have a great deal of stamina and work hard. They take satisfaction from being busy and productive. So there's your answer. Well, sir, my greatest strength is that I'm an achiever. I have a great deal of stamina and I tend to work hard. And I take great satisfaction from being busy and productive. Shit. Next question, Holmes. How are they going to come back on you on that one? Yeah. It doesn't require any more. And matter of fact, they'll be so pushed back to be like, okay, what did you just say? How were you so prepared for that? So what's your greatest strength? Well, I'm an activator. I can make things happen by turning thoughts into actions. They may activate on thoughts, feelings, or decisions. I don't understand that part. I think they mistyped that. Okay. Yes, sir. I'm an activator. I can make things happen by turning thoughts into action. It's my greatest strength. So my greatest strength is adaptability. I have the ability to think about the ability to think about all the factors that might affect the situation. I can weigh things through. I think things through with logical, deep, thorough, comfortable with numbers and figures. My greatest strength is belief. I have certain core values that are unchanging, and out of those values emerges a defined and purpose for my life. Command is my greatest strength. I can take control of the situation and make decisions. Communication is my greatest strength. I'm a good conversationalist and presenters. I generally find it easy to put my thoughts into words. And you see the list goes on and on. So what you do is you read through these and you find the ones that apply to you. Like WOO, the last one down there. It stands for winning over others. And people strong in this thing. Well, sir, my greatest strength is that I'm a woo. I enjoy winning over others. I love the challenge of meeting new people and winning them over. I derive satisfaction from breaking the ice and making a connection with another person. If in their job announcement, they said they needed somebody who's good at the front desk, there you go. I'm a woo. So I will find mine and I will email that to y'all today. It's in there somewhere, but it's the same stuff. Achiever, activator, adaptability, and so on. Look through these and pick out a couple of them that are you. Oh man, that's me right there, man. Mine were command, context. I know I chose that one, and developer, and I also chose focus. And I think that was it. Oh, I chose input as well. All of those saying something about me. So input, I collect information, ideas, history, even relationships. I have a need to collect and archive information. And y'all see all the crap I have on my damn computer. I don't throw anything away. So input. Okay. I refer to blah, blah, blah. So learner. I have great desire to learn and want to continuously improve. In particular, the process of learning rather than the outcome for me. I just enjoy learning. All right, so those are examples of strengths, and I'll send that out to y'all today. Another question that's commonly asked that doesn't say anything about you. So, Mr. Mahone, what do you consider to be your greatest weakness? And y'all have heard me say it before. State what your weakness is and then tell them how you accommodate for that. Well, my greatest weakness is probably that I'm a pessimist. And as a result, I have a backup plan for everything. Tell them what it is and then how you accommodate for it. And so again, all those interview questions. This one right here shouldn't even be there. These are people who don't know how to interview. Did y'all know that you should not be asked why you're leaving your last job? So, Ms. Mon, why'd you leave your last job? It's not an appropriate question. And neither is how much did they pay you at your last job? It's not appropriate. But too many people are not interviewers. They're office managers who have to do an interview today. And they don't know how to interview. And since somebody asked them during their interview why they left their last job, they think it's an appropriate question. It should not be there. Okay. Tell me about a
Mr.
time.
Mahone.
Yes. Yes.
So when they ask you, because it's on the application, how much did you make at your last job, and like what's the reason for leaving, or why did you know?
Mm-hmm.
So you're telling me that we don't have to answer that, or?
Know this, guys. If it's on the application, they're going to expect you to answer it. Do you have to answer it? No, but you probably won't get the job. If they ask you that during an interview and you don't answer them, you probably won't get the job because you just put them in their place, and nobody wants that. So if they say to you, "So, Mr. Mahone, why'd you leave your last job?" and you say, "Well, sir, I don't think that's an appropriate interview question, and I choose not to answer," you're not going to get that job. So here's what you do. Something generic, something that doesn't mean anything. So, Ms. Mahone, why'd you leave your last job? Personal growth. Looking for new challenges. You know, something that's just generic. Never speak bad about your other company. Never. I didn't get along with the boss, or they wasn't paying enough, or they wouldn't give me a schedule to let me go to school. Never anything negative. Because if you say something, remember, if you'll gossip about them, you'll gossip about us. So never say anything bad about the company. Just throw something generic at them and be prepared for something generic. Like I was looking for personal growth. I was looking for new challenges. Okay. So anyway, I got bored with the job. No, never say anything negative like that. Just looking for new growth, looking for new challenges, looking to work in a different area of healthcare. Just something generic. All right. And what do you expect salary wise is probably the most unfair question on the application or during an interview, because they're trying to get you to undersell yourself. I mean, imagine this. You go to a used car dealership and you ask somebody, how much is this car? And they ask you, well, how much you got to spend? Are you going to do business with that person? No, I'm walking the hell out. I know you tripping. You don't want to tell me how much the car is. You want to ask me first how much I got to spend so you can adjust the price. No, I'm walking out the door. So when they ask you, what are your salary expectations? They want you to write a number down there because they know how much they can pay you. So why are they even asking? Because they want you to say $12 an hour, when the boss told them the max that they can spend is 15. So they can go back into the boss and say, hey, boss, I got him for 12. Hey, not just a good person. They want you to undersell yourself. And that's why I give them a range like this. So to answer this question, if I was applying for a medical assistant today and I saw that the range was $12 to $17 an hour, my answer would be, well, sir, I went online and I saw that the average salary for medical assistants in this area is between $12 to $17 an hour. With my experience, I would expect to come in at the $17 range. Or because I'm fresh out of school, I would be willing to start at the lower part of that range and then see what they come back with. Now, what happens if they say, we haven't gotten to that part yet? We're still the first interview. The first interview, they're just feeling you out, guys. What kind of person you are, what's your character like, how professional are you? Sit up, make eye contact, smile, don't slouch in the chair. If there's something that during the interview you think you might need to hand to the interviewer, have that in your lap, not down here in your bag on the floor. So have a little folder with you with your resume in there. I always ask for a resume. Even though I've already got one, I could have one sitting right there on my desk. Come on in, have a seat. So you have a copy of your resume for me. And see how organized you are, how prepared you are. Yeah. So if there's something you think they might ask for, your list of references, have all that in a folder right there with you on your lap that you can just hand to them. Sit up straight, make eye contact. Don't slouch. Smile, when you think it's appropriate. Okay, so they're asking you all these questions, You're doing the best you can. We expect you to be nervous. If you're not nervous, we might wonder about you a little bit. Why aren't you nervous? Are you not taking this seriously enough? Dress yourself appropriately and go in there and put your best foot forward. Don't panic about it. The worst that could happen is you not get a job. They're not going to call the police in on you and arrest you if you answer a question wrong. Okay. The worst that could happen, you don't get that job. All right, now, you came in, you saw me. We looked at your resume. I like what I saw. I like talking to you. Thank you for coming in. I've got some other people to interview. Thank you for coming in. 2 days later, you get a call from me. Hey, Talisha, how you doing? Yes, this is Mr. Mahone calling back. Listen, I enjoyed the interview we had. When can you come back in and see me? Same answer as before. I can come see you right now if you like. This morning, this afternoon, or whenever is appropriate for you. Well, come on in and see me. That's when you want to be ready to discuss salary. So yeah, listen, I talked to the boss. Told him I got a good vibe about you. And what's it going to take to bring you on board? Be ready with a number. Or do what I just did. Well, I went online. I saw, 12 to 17 in this area. With my experience, I would expect to come in more towards the $17 range. Oh, can't pay that much. Can you do it for 15? Well, 15 is a little lower than I would like to come on board for. Can you do 16? Now it's time for the back and forth. See, that's why we save it for the second interview. It's time for the back and forth, the negotiation. Y'all heard me say something, I think it was yesterday, or it might have been this morning, when I mentioned that women tend to make less than men on a job. Is that true? Women tend to make less money than men doing the same job. That's absolutely true. But did you also know that men are 80% more likely to negotiate during the interview than women? It's not a sexist thing. Nobody's out there saying, well, we're going to pay men more than we pay women. No, men are more likely to negotiate. To say, can you do 16? Can you do 16.50? And if they can't, thank them for the interview. And get a little attitude and walk out. Be burning them bridges. Because here's how it could go. Well, Mr. Mahone, I can't pay 17. Would you consider 15? My boss has capped me at 15. So there's no way you can come up to maybe 16, 15.75. Can't do it. Well, listen, I really appreciate you having me for the interview. I would really like to work here. I just can't come on for that amount. But thank you very much for seeing me. And you're more likely to get that call later on in the day. Hey, Mahone, yeah, listen, I talked to the boss, and he told me I could come to 15.75. How's that sound? You're more likely to get that call back. So don't burn them bridges, man.
What about the contingency ones, Mr. Mahone? Like
what?
when sometimes they'll be like, after your 90 days, we can up your pay.
Yeah, they might say something like that.
Should we still walk away from that and be like, well,
no, that's up to you. Like I can't tell you what you can accept and what you can't. That's up to you. If they offer, we start you at 15, and after your probationary period, we can bump you up to 16. Can you do that?
Mr. Mahone.
And you decide whether you can. Yes. Yes, Melissa.
But the pay for the PCT is between 15 to 17, right?
No, I don't know. No, what I will never do with y'all, and what nobody at the school should do with y'all, is actually give you a salary number. Because then it implies that you're going to graduate and work and get that salary.
Okay. I'm asking.
Right. And we can't guarantee that. So that's why we'll give you numbers, but nobody's saying that PCTs are going to make this much money. We can't say that, because then we're locking us into a guarantee, and that could be sued. They told me I was going to make $15 an hour. No, that's not what we're telling you. So nobody at the school will ever discuss salaries with. So don't take it personally when the teacher kind of sidesteps that question. So Mr. B, how much do PCTs make? Well, you always gonna get something like that. Well, it depends. There's always going to be some variables in there. So we'll never give you an actual number. But what were you saying, Melissa?
I was saying that, hold on, Sebastian. I was saying that because I Googled it and I was doing my own research.
Okay. Okay. Yeah. So that's what you want to do. Yeah. You want to do your own research and take that number in with them, because they might ask you, like they asked me when I told them I wanted so much a year. They said, well, how did you arrive at that number? So they may ask you that. So 15 to 17, how did you arrive at that? I Googled it and got the mean salary for medical assistants in this area. So go ahead, Renisha.
Okay, on your internships, are they usually hiring? Are you guys doing the ones that like are looking for employees already? Or are you guys doing more that you have a contract
No.
with them already?
And they're externships, by the way. The difference between an intern and an extern is that interns you get paid for, externs you don't. Okay, so it's important that we understand that these are externships, but we don't use the revolving door places. You know, where you go in and you're extra hands for them for a couple weeks, and then somebody else comes in. We use places that are hiring our students, and that's why we use university for the PCTs. University hires almost all of our students. And as far as the clinics go, we rotate between making sure that we have clinics that are actually hiring people and not somebody who just wants you to come in and file their records for a couple of weeks for them. And that's what Miss Zapata does. Make sure that our extern sites stay fresh and new, and we're not using those same revolving door clinics over and over again. Okay, so let's take a 10-minute break. I want to go out and say hi to my wife. She's home for lunch. Let's take a 10-minute break, even less than that. Let's come back a quarter after, and we'll finish this up. All right. So you just had that first interview. You did okay. You answered questions. You stumbled on a couple questions, but we expect that kind of stuff. Called you back in, and we have arrived at a salary agreement. And now they might want you to meet the doctor. Yeah. Well, we're hiring somebody to work side by side with Dr. Smith. So Dr. Smith's going to come in and spend a few minutes with you. Just, get a feel, and y'all can talk for a few minutes. Okay. And now the interview process is getting more casual. You can start with yes and You can try to get away a little bit from the yes ma'ams and yes sirs, and yes, I've always wanted to do that, and Make that eye contact. Put yourself in a positive light. Smile as much as possible without being stupid with it. Make eye contact without being too intense with the eye contact. And just, relax and enjoy the rest of the process. But don't get too relaxed. Even when you're hired, it's not time to relax. Remember, you are the new guy now. In the Air Force, we used to call you the FNG. You're the FNG, the effing new guy. Okay. So it is not time to start sitting in the break room and eating chips when the rest of the employees are. It's time for you to start organizing yourself with the organization, walking around, seeing where things are. Spend your break time in the supply room, finding out where all the supplies are. So when somebody asks you for something, you can go and find them. Find those supplies. Time to, on your externship, guys, you do not want to sit around on your ass doing nothing. When everybody else takes a break, it's time for you to grab your damn book and start reading up on something that you did in the past couple of hours, couple of appointments that you had that you didn't understand why the doctor was tapping on the patient's face. It's time to start reading that kind of stuff and show yourself as being productive. If nothing else, start cleaning some shit. They can't fault you for that, man. Grab some wipes, start wiping down the tables and chairs or something. Walk out and start straightening up the lobby. Stack up the magazines on the table. Show these people that you are not the type of person that has to be guided all day long. When it comes to a point where you have nothing to do, you will find something to do that benefits that company. Now is not the time to go sit in the break room with everybody else. Go get yourself go find yourself something to do. When we were drill instructors, in the drill instructor break room, if you come walking your ass in there and you are not a certified instructor yet, somebody's going to say something to you. Like, what are you doing in here? And it's just like that. You walk in, what are you doing in here? Oh, I'm taking, no, you're not. You see that book you got in your hand? When you know everything in there, then you can take a break. Literally. When you know everything in that book, then you can take a break. Until then, your ass need to be outside practicing those lessons. Okay? You need to be in there putting equipment together, figuring out this machine and that machine and practicing with it, putting the blood pressure cuff on your own arm and testing how to get that thing on and off and so on. It's time for you to continue your learning. This is not the time to sit around and go, oh yeah, well, I got the spot. No, you don't have the spot. You won't have the spot for 90 days or so. For that 90 days. And that's why I fired so many people in the emergency room, y'all. Those weren't workers. If you were an employee in the ER, you come in my office, we sit down, we talk, we turn it into a learning experience and don't do it again. But if you're a probationary, gomer your ass. See you in a year. In other words, go back to the wards, learn some more, try again next year. So that's why we were firing so many people. It wasn't like you walk in and you fire an employee. Those people were probationary. You let them go for the slightest thing in those 90 days. That's the time where you really need to have somebody look after kids. That's not the time where you need to be walking into the manager going, I need to take tomorrow afternoon off because my kids got this or my kids got that. That's the time for daddy, auntie, grandma, grandpa, somebody else to take care of that with your kid for you and arrange it, make it happen. Now, don't get me wrong. If your kid somebody calls you from school and your kid is sick, yeah, we expect you to go over and take care of that. But we expect you to also keep that kind of stuff to a minimum during that externship and during those first few months on that job. You don't have that kind of flexibility yet. Okay. When somebody walks into Mr. Compost and tell Mr. Compost, you need to be wearing a lab coat, Mr. Compost needs to put a damn lab coat on. When they walk into me and say, Miss Mo, you need to put a lab coat on, I'm like, whatever, man. See, I've been here a while. I've been around this kind of stuff. I know how to move through the system. You need to be doing what you're told to do during that period of time. All right. So you've got the job. You're good to go. And now it's time to start looking at, okay, how do I grow in this job? Or how do I grow beyond this job? There's a couple questions I didn't mention that you could ask during an interview, and you should know these. When they get done with all of their questions, and they say, okay, Mr. Mahone, do you have any questions for me? You should have a couple questions prepared just to show that this is not just something you're taking lightly. Have a couple questions for them. And if there are no other questions you can think of, here are two that you can use. Write these down. Number one, what are you looking for in the ideal candidate for this position? What are you looking for in the ideal candidate for this position? And that gives you a chance to come back on them. Well, I need somebody that's reliable. Well, sir, my 20 years in the Air Force has built in me a strong sense of reliability. Gives you a chance to come back at it. So what are you looking for in the ideal candidate? Well, I need somebody in here who is organized. Sir, I have very strong organizational skills. Gives you a chance to come back on them. What are you looking for in the ideal candidate? And number two, when do you plan to make your hiring decision? It's a general question out there, so I'll know when I'm pretty much assured that the position has been filled and I wasn't selected for it. So what are you looking for in the ideal candidate, and when do you plan to make your hiring decision? Two questions that you can throw out that just makes it seem like you are into this job. This is the job I want. All right. Now, like I said, we expect you to be a little nervous. Do I want to save this? Did we make, yeah, there's a couple changes we made I want to save. All right. All right. I want to share another video. This is not a job interview, but similar. This is how we test for things like airman or soldier of the quarter and that type of stuff in the military.
Go around this chair a little bit. So I want these soldiers to get a leg on their feet. They say you're ready about to find out. So I squat there. Tell me ready. Prior reporting to social out of the month board as directed. wrong, I was wrong. We get one of those degrees, one person. Edit. Right, first class animal reporting to the soldier above board as directed. Officer, I need you to sign over the creed, and nobody got to write all day. Sign over the creed, let's take it to the chair. Lord, the soldier's creed. I am an American soldier. I am a warrior member of the team. I serve the people of the United States and live the Army values. I will always place the mission first. I will never accept defeat. I will never quit. I will never leave a fallen comrade. I am disciplined, physically and mentally tough, trained proficient in my warrior tasks and drills. I will always maintain my arms, my equipment, and myself. I am an expert and I'm a professional. I stand ready to deploy, engage, and destroy the enemies of the United States of America in close combat. I am a guardian of freedom, American way of life. I am an American soldier. Excellent, son. And nobody got to cry out all day. Take a seat. You deserve it. Take a seat. Whoa.
Okay. This is just to show you that you can prepare all you want, but it doesn't prepare you for the unexpected. How long do y'all think Sandoval practiced that creed? I'm an American soldier. Ah, da, 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 da. Hours at that. And look, they wanted him to put the chair up and sit down. That's all. He's trying to squeeze his ass into the chair sideways like that. Okay. Now, you saw a couple people didn't prepare at all. You see when the one guy left, the black guy, how he came bebopping in there? First thing they said, look at him bebopping. And when he left, one of the other guys said, was that Bravo Company? In other words, who's this guy's boss? And why didn't his boss prepare him for this shit? Sandoval, man, he snapped in there, snap, snap, boom, sir, da, 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 rambled off that creed, told him to sit his ass down, and boom, he tried to slide sideways into the damn chair. Okay. So you can prepare, you can practice those interview questions and all that, but you still have to be prepared for the unexpected and be able to think on your feet. Yes, you are to be nervous. We expect you to be nervous, but we don't expect you to be so damn scared that you can't think on your feet. So, and that's what the doctor might do when they come in, just talk to you. Come in and sit down, and the doctor just get all comfortable and see if you do the same thing. Do you, or do you sit up and conduct yourself in a professional manner? Okay. So anyway, I just like to see that one because it is funny. I've done that several times on both sides of that table. Where I went up for Airman of the Quarter, Airman of the Year, that type of stuff. And I've also done it on the other side of the table as well. Yeah, you do see dumb stuff in there like that. People who just are not prepared. Prepare yourself, guys. And if you are ready for the stuff that you can prepare for, it's less stress having to deal with the things that just might come up. All right, so that is, wrong one. Resumes and our job search. I'll give you an example, chronological resume and then functional resumes and then combination resumes, all three that we talked about. Cover letters, we're not going to cover letters, not going to require cover letters right now. We're not going to go over that today. But a cover letter is another way, just an extra time for you to introduce yourself to this person. When you're writing a cover letter, it is not a restate of your resume. So you're not going to go in this thing talking about your skills and all of that. A cover letter is simply about you. Good morning, sir. My name is da-da-da. I'm a new graduate from Quest College. I got into healthcare because I've always wanted to work with children. I enjoy helping people to ease suffering or whatever, and just talk about yourself in there. Cover letters are really, really difficult to write. And what do you do when you have to write one?
Google it.
Google that shit. Medical assistant cover letter. And boom, you'll get hundreds of examples. You can cut and paste just like you did with your resume. Write down just a little bit about what to include in a resume, how to organize your cover letters and so on. Job applications, guys. I don't like online applications because when you do, they're going to ask you to paste your resume in there. And when you do, it's going to take out all the formatting. It's going to justify everything to the left. I hate that, but you know what? Some places will only accept electronic applications. When I want to apply for a place, I'll call them and ask them, listen, is there any way I can come by there and pick up a paper resume? And if I do, I'll ask them for two. One to practice on and then one to actually fill out and turn in. Check your handwriting on there, print everything, and make sure you don't leave any open blocks. If there's a block that doesn't apply to you, then go in there and circle or NA that bad boy, either way. If it doesn't apply, make sure that they know you didn't just leave that block empty. If they ask you for salary requirements, try to do that range in there rather than putting a number. And the sad part about that, guys, is that if you put a number, if you put 18 and they know they can only pay 17, they may not even call you. So that's another downside of putting numbers in there for salary requirements. You may just sell yourself out of the job. They won't even call you because you want too much. And if you put 12, they're not even going to offer you the 15. They're going to offer you 12, what you put on there. So that's not fair, but it's part of the process. All right, pre-employment assessments. You might be required to take a test. And it's usually not a skills test. These are just usually knowledge tests. If you go to Texas Med Clinic, you're going to take a math test. I know they do that. Just to see your basic math skills. If you apply to be a teacher, you're going to have to teach in front of us. Yeah. All the teachers will come together in a room and you come in and you teach a class to us. And then after you're done, you leave and we all sit around and talk about whether or not you should be hired or not, or whether or not you should be hired. Okay. So there are some pre-employment assessments. Some of them might be character assessments or personality assessments. Remember, we might do a personality assessment to see what's the best place to put you in an organization. A character assessment to see what kind of person you are. So there are pre-employment assessments out there. It's usually not going to be something like draw blood for us. It'll usually be knowledge tests. And that's not done during the interview. Nobody should be asking you questions like, what does this word mean? Or what does that word mean during an interview? Preparing for an interview, we've already talked about all that good stuff. Then the resume itself. This is a different resume. You see a different organization there. But as long as the things that are appropriate are there. And all of these are samples of resumes towards the back of this handout. All right. So anyway, that is professional development. So you might have any questions about resumes, job interviews, career planning, anything like that?
The same question I had asked you earlier, remember?
Uh-huh.
About if I could use the computer and if someone was available to help, just for the simple fact that I've never made a resume before, and I just, you know what I mean? I don't know how to prepare it.
Well, take it and use that template that I sent you, and start typing your name and stuff in there. And you've already started your resume. Remember the The only part y'all really going to have to create is going to be the employment objective. Everything else is just a listing of stuff you've done and stuff that you know. Remember, all of this is gimme right there. The skills you learned in school, what schools you went to, and where you've worked. All of that, it just falls right into place. This is the hardest thing on there, right in the employment objective. And you've already got a sample of a good one in there. So change it, adapt it. If you're not organized, come up with another word to put in there. Like what we got, organized, enthusiastic, team player. How about self-driven? Enthusiastic team player. So again, this is how you're going to doctor this thing up. Find words that apply to you. If you don't know if you kind of don't know what you want to say right there, come in and see us. And that's what we help you with. How to word things. Well, Mr. Mahone, I want to say that I work good with kids. We'll come up with a way to help you say that. So that's what we're there for, to help you with this. And remember, you do have some time. So, you'll start with the worst piece of shit resume ever. Probably the first one you write. Bring it into me and I will red ink that thing to death. Guiding you. The next version will be a little bit better and better and better till the time you're ready to actually use it. Bang, you got that shit down. So don't panic if you've never done one of these before. Just start right now. Melissa Lucio. Leave these here. You'll have them all three. Put your address in there, your email, and your phone number. The skills will probably remain the same. You might want to go in here because you don't type 30 words per minute. Take that out. Oh, I'm not real proficient with Microsoft Office. I don't want to lie. Take that out and put something else in its place. Down here, start filling this in. Your expected graduation date, you can go and put that in there. Your high school. You got a high school diploma, leave that like it is. If you don't have any college credits, take that out and start putting in your employment. And this is a time for you to start, okay, what can I call it when I did there? Again, ask us, we can help you with that. So it's not that difficult as far as just changing this information to yours and then coming up with one of these right here, an employment objective. It's going to be your hardest part. So go online, print the page if you have to. The page that had all those different employment objectives on there, start lining stuff out. Oh, I like this one, circle this, take that out, and type it all into a paragraph when you're done.
Okay, and Mr. Mahone, when is it due? Like, when do we have to have this prepared?
I would have my resume done by 2 months before you finish school. So if your expected completion date, not your graduation date, but the day that you actually finish on-campus classes, go a couple months ahead of that, because your last class will be extern. So 2 months before you start your last class, you should be starting to get a little excited about getting this done. And before you're ready, about a month before you're ready to go on that extern, you should be able to hand one of these to Miss Zapata when she asks for it. Can you go to Miss Zapata before then? Miss Zapata, hi, yeah, listen, I'm working on my resume. Can you give me any pointers? Yes. And by then, y'all will know who Miss Zapata is, okay? Because she'll have you'll see her during your regular classes. So you'll be able to walk in and say, Miss Zapata, listen, is there any way that I can do my extern at Kellum Clinic in over on Martin Luther King? And if we don't have an agreement with Kellum Clinic on Martin Luther King, we'll ask you to go over there. Go over there and get us the contact information because we have to have a contract with them. Go over there, get us some contact information. We'll contact them and see if they'll accept you as a resident, as an extern. Can you find your own extern site? Sure you can. And how would you do that? Cold call the place. Walk in there. Hey, how you doing? My name's Mr. Mahone. I'm a student at Quest College right now, and I would really like to do my externship at this clinic. Is there any way, do y'all accept extern students here? And when you say extern, they're going to know exactly what you're talking about. Every medical profession has an externship. They'll know exactly what you're talking about. And they'll tell you, oh no, we don't do externs here. Well, thank you very much. Or, well, I have to ask the office manager, would you please? And then can I leave my contact information? If they say, well, yeah, we do them sometimes. Well, can I get contact information that I can give to our extern coordinator so she can arrange that with you? So that's what we mean. When Miss Zapata says, I need contact info, somebody that she can call over there and set up and talk to and see if they meet our requirements for externship. Because it can't just be in a clinic. They have to meet certain requirements. So whether you can do it at a place of your choice, the next time you take your kid to the clinic, if you like that clinic, ask them. Yeah, how you doing? I'm in medical assisting school right now. Is there any way that y'all do externs here? Because I would love to do my externship here at this clinic. And then bring that information. What you would need basically is if you can get the card of the office manager, that's exactly what Zapata needs. So can I get one of your office manager's cards? And that's who Ms. Zapata will be talking to. So anyway, guys, the best thing about this whole process is don't panic. Okay? Our students get hired at a rate of approximately 85%. And that 85%, the other 15% are those students who move out of the area after school, those students who graduate and then they go get a job at wherever, just because whatever happens in their life, and those students who graduate and then get pregnant. So we're at 85%, which is high for a proprietary school. Most schools are down around 50%. So 85% of our students will be hired off of their extern site. And that's pretty damn high. That's pretty good. Yeah. So don't panic about this process, but don't take it too lightly either. I had a student walk up to me in the hallway one day. This was when I was the program director at Quest. Student walked up to me in the hallway. Mr. Mahone, you find me a job yet? Excuse me, Slick? Who the hell told you that we were an employment agency? We offer employment assistance. We'll help you, but I'm not going out and find you a job. No, that's on you. And my question back to that young man was, how many resumes did you send out this week? Oh, I thought you would do that. You better guess again, Slick. How badly do you want that job? And how hard are you willing to work for it? I had a lady call me from, I can't remember what clinic it was. It was a family practice clinic. It was over near the Rim. And she said, Mr. Mahone, I mean, we've done business before. She said, Mr. Mahone, do you have 3 medical assistants? I said, are you kidding me? Of course I have 3. She said, if you send them today, I'll hire them today. I'm calling people. I'm like, hey, get over to right now. I'm on my way, Mr. Mahone. Somebody tells me, well, is there any way they can see me tomorrow afternoon? Whatever, Slick. I called the next day, one of the students, to see how it went. I said, hey, I can't go right now, Mr. Mahone. I'm in orientation. That lady was true. The first 3 medical assistants that showed up at her building, she hired. And they were in orientation the next morning. So how badly or how much are you willing to work for that perfect job or that first job in healthcare? Remember, here's what's probably going to happen to most of you. You take what you can get until you can get what you want. I don't care that I want to work in peds, that I don't want to work in peds. If they offer me the damn job right now, I'm going to take it. And while I'm working, I start looking for the job that I do want. Yeah. So how badly do you want that job, and how much effort are you willing to put into it? With a higher rate like 85%, there's a good chance you're going to find that job before you graduate, before you walk across the stage. Our goal is to have most of those students that walk across the stage already working out there. And we are pretty close to attaining that goal. So anyway, how much effort are you willing to put into it? All right. So that brings us to the end of professional development. Kind of enjoyed these few days because tomorrow is back to the textbook. We're going to be doing chapter 14, looking at the hormones and how they work in the body and so on. Our hormone producing glands, we refer to those as endocrine glands. So we'll be doing endocrinology tomorrow, chapter 14. Next week, we'll be doing muscular system and skeletal system, the two versions of orthopedics. So we cover that next week. So right now, I'm going to, do I want to save this? Yeah, I'll save that with them. All right, close that. I don't want to save that. All right. No, I don't want to go into there.
While you're doing that, Mr. Mahone, I have a question for you.
Sure.
About my educational path. I am a quest to be a PCT, but I would like to end up with my RN. What program or education do you think I should reach for next in those little baby steps? Because I can't just go in for 4+ years. That would be too much.
Okay, one thing is that I would advise you against, let's see, Sunday's the 30th. Yeah, I can't do two things at one time. That's my ADD. So Sunday is the 30th. Make this due Monday. So you have all day Sunday. I would advise you against doing another certificate program, because I see that a lot too. People who do MA, and then they say, okay, well, I want to be a nurse, so I'm going to go on and do the vocational nursing program next. No, you've already got one certificate. Why go after another one? Once you achieve a certificate level training, you need to be looking at degree now. So I would advise anybody to start looking at a degree program that's going to fit their goals. In other words, get you to where you want to go. If you want to be an RN, I would start with an associate RN. 2-year class or 2-year program, get that done, and then you can look at the 4-year RN. So again, do it in increments. Don't try to just jump in the deep end of the pool. But at the same time, don't go lateral either. Lateral means I have one certificate, I'm gonna go get another certificate. Why would you do that? You need to be doing this. From certificate level, you need to go next look at degree level, and then higher degrees from there. So start out with associate, bachelor. Everybody does that. Associate, bachelor's, master's, And next thing you know, you're a doctor of whatever out there. Yeah. So for RN, yeah, associate RN program. Just start looking around. Who has a 2-year degree out there in registered nursing, and what does it cost? Do they have any tuition assistance and that type of stuff? Yes.
Back in the days, I don't know how long ago, but Quest College used to give LVN, right?
Yes.
Because my sister is an LVN and she got it here with Quest College. And I was looking to get into that program, but then when I called the school, they said they only had PCT and MAs.
Yes.
And
the vocational nursing program at Quest College was shut down because their performance metrics were horrible. Their pass rate was way too low. Their employment rate was way too low. So we had to shut that program down. It wasn't viable to our students. We had employment rate of something like 35%. And the pass rate for the class was down in the low 40s. So it was a horrible program. The person that set it up, guess what they did? They set up a horrible program. And rather than try and fix it, we just decided that that was a headache that we didn't want to continue with. I had a lot of say-so into whether or not we continued that vocational nursing program. And my vote was to no. Their metrics are way too low. And in my experience, guys, having vocational nursing programs in the building with other programs was a disaster. It was a total disaster. In other words, whenever you have vocational nursing MA programs in the same building, it's a disaster. The reason is that these people over here always think that they're the pinnacle of healthcare. And those people going into medical assisting, they are beneath us. I know it sounds odd to say that, but that is every experience I've ever had. And it comes from the nursing teachers. I will not hire a nurse to teach in my medical assisting programs. I will not do it. Because they come in with that attitude of, y'all are learning beneath my level of functioning. For some reason, nurses just think that they are the pinnacle of healthcare and everybody else is beneath us. And it always plays out for us, y'all, or it always plays out exactly the way I tell them to. When they say we're going to hire a nurse, I always tell them, no, you don't want to do that. And they go, well, we have. Okay, well, fine. You're going to see. Remember I said it all comes out in the wash. They hired this one lady. She's a nurse, RN, 4-year degree. Everybody else is down there. I'm up here. Okay. And she walked in my classroom one day and she said, Mr. Mahone. Mr. Mahone. Oh, she had a real attitude. Mr. Mahone, the autoclave doesn't work. I said, are you sure? Yes, I know the autoclave does not work. I said, well, that's kind of funny because we don't have an autoclave. Yes, we do. No, we don't have an autoclave. Oh, yes, we do. We walk down to the lab. That right, the autoclave doesn't work. I said, lady, that's not an autoclave. It's an incubator. And she said to me, well, whatever it is, it doesn't work. And I said, yes, it does. The power button's right here. Did you turn it on? I'm pulling the whole, is your computer plugged in thing with her. Did you turn it on? Well, there's no power button. Yeah, it is right back here. Ooh. Now, not only does this lady not know what an incubator is, she doesn't know what an autoclave is either. And she's teaching the medical assistant classes. But this is an RN, somebody who is above the rest of us. They don't do what we do. They don't do medical assisting. They cannot teach a medical assisting class. And that's what I mean when people out there think nursing is the pinnacle. They think that if you're an RN, you can teach any medical class. And that's not true. And unfortunately, during that time, the president of our school was an RN. And when I took the job over here, I told Greg Falcon, I said, listen, I will take this job, but I don't want anything to have to do with any nursing programs. And he said, oh, no, they're in the other building. You won't have anything to do with that. And that shit started invading my programs. So anyway, no, the nursing program was just not a good program here. The person that set it up was horrible. The teachers were horrible. And I'll just tell you that. And that's the reason that the program is gone. Our cosmetology program faded away just because the program was not a good program. So we decided to focus on different certificate type programs. You can find nursing schools all over town. So why do we need to have one too? My latest suggestion has been massage therapy. Okay. We need to start a massage therapy program.
Do you guys accept homeschool diplomas? Because my daughter is considering that, and both my kids have only been homeschooled. This is not a corona thing for us.
I'm sorry, what did you say?
I was asking if Quest accepts homeschool diplomas, basically a non-accredited diploma.
For high school, I don't know. That's something you're really going to have to, just approach with them. I don't get into that side of it, the admissions part of it, what degrees or what diplomas they accept. I never got into that kind of stuff. So I just don't know whether how they accept homeschooling. Whether homeschools, I know homeschools don't have to be accredited because they're not accredited. They don't have to be. So I don't know whether they accept that diploma or not. If you went through the whole Texas state testing part, then they probably more likely to. In other words, if you took the same TOS or STARS test or whatever they give to the regular students and you pass it, then I'm pretty sure they would accept that diploma. But that's something you're going to have to talk with the compliance people. I really don't know. I don't get into that part. All right. So any other questions before we finish today? We're about 5 minutes over. Here is your quizzes for professionalism. Yes, go ahead.
No, I'll ask you the questions when we're done, when you're done.
Oh, no, you can go ahead. I can.
No, it was concerning the prefixes. I could ask you after you're done talking.
Okay. Well, I'm pretty much done talking. I just need to attach this thing right here.
Okay. Well, the prefixes, right? We have a quiz and it's due tomorrow.
Yes.
Okay. You didn't send me a review on that. Did you send a review?
Yes, the review was that document.
I'm sorry, go ahead.
The review was that document that was sent out that said all word parts and their answers. It started with the root words, arthro, veno, flevo, Go down a couple pages. It starts with the prefixes and suffixes.
Yeah, I have it written down. I just can't find my email. Anyways, what's it called? What else was I gonna ask? Is that also the combining words or no? That was totally different.
No. Combining forms and prefix suffixes were two different tests, but they're all in the same handout.
Okay.
Let me go into here.
And I saw that the quiz was sent out August 24th, and I'm just not sure if I took that quiz for the combining words.
Okay.
And also, I was wondering if you could please send me that email again with the prefixes and stuff, because I have the notes here. I just don't have, I want to go back into the email and look it up, to make sure that I have everything written down before I take the quiz.
Okay, it's attached to the email that I'm sending right now. All right, so in this email, you have your quizzes for professionalism. You have your professionalism review, and I've reattached all the word parts with answers. So the prefix suffixes are in here, along with the acronyms and abbreviations. So that is due by Sunday night, the professionalism. Get that quizzes done by Sunday night. All right, any other questions? Let me send this. All right. This is getting out of control here, man. I hate people who reply to all, and you keep getting all these emails that just block up your damn email. But anyway, so that is that for today. No other questions, then we'll call it a day.
Mr. Mahone.
Yes.
I had a question.
Uh-huh.
Okay, I'm going for MA. But I was trying to see, I wanted to go for LPN. Is it better to go for LPN or registered nurse?
RN. Remember, it says you
RN?
got,
Okay.
yeah, you got one certificate already. Why go for another one? You know, you're going to have a medical.
Okay.
The certificates get you working. So get out there and get working. And if you want to be a nurse, might as well go for the money now. And go for the.
Okay. Yeah, because I'm in the medical field now. Yeah, I'm in the medical field now. So I was trying to figure out which one it was to take.
Yeah. Okay. So yeah, I would go to RN. Why go BN?
Okay.
And when it's another certificate. Okay. All right. All right. All right. So anyway, I'm trying to figure out. I'm stop this because I just saw something made me go, "What is that?" But anyway, any other questions? Anybody?
Yes, Mr. Mahone. I'm sorry, but you said what was due Sunday, you said?
Sunday.
I'm a little confused.
Okay. And I don't understand why. Okay.
Well, because we have a quiz that's due Friday or
Yeah.
today, and then what's due Sunday?
Yes. And the one that's due today is root words or prefix suffixes. The one that's due Sunday is professionalism, what we just finished covering.
Okay, got it.
Okay. Now remember what I told you guys. Write this stuff down. Okay. Keep it in your notes. What's due when, because you don't want to miss a due date. Okay. Write it down. Now, did everybody just write down what I just said? No. Half of you went, okay, I got it. No, you don't have it. Friday, prefix suffix test. Get it done before tomorrow. Professionalism test is due by Sunday. Write that down on a piece of paper somewhere. Okay. All right. Any other questions? All right. We'll see y'all tomorrow morning at 8 o'clock, chapter 14. We'll be doing endocrinology. Always write everything down.